Good morning, all. Welcome to the Thursday, February 20th, open session for Carroll County Commissioners. And as we always like to do, we'll start with a pledge of allegiance and a moment of silence.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We're doing our agenda a little bit different this morning. At last Thursday's meeting, it was asked that Access Carroll be put back on the agenda. And so what we decided, to avoid confusion, it's the first item. It'll be before Priority Carroll, then we'll do Priority Carroll, and then we'll go on with the rest of the agenda. But that way, the people interested in coming can be here. If you want to do public comment, you have 3 minutes, and Roberta will be in here in a minute to just pile the cards on the corner of her desk, and she will call you, anybody that has a card. And Chris, you'll let us know if anybody calls in, correct?
That's correct.
Okay. And I guess the best way to start, you asked for it to be on the agenda.
Yes.
So,
Well, it's something I asked to be on the agenda. I don't know if we want to hear public comment first or how we want to approach this morning. Obviously, there has been a lot of conversation about this in the past few weeks. Some conversation here last week about it as well. We've had conversation with staff. I mean, I know a number of us have talked to various people in the community. It's always great to hear from our community as a whole. Whether or not we all agree or not, it's always good to have that interaction. I appreciate everybody being here this morning on all sides of this topic and issue. Recently had the opportunity to meet with Tammy Black from Access Carroll and Sharon McLernan, who is with LifeBridge, and I had a nice conversation with them as well. I think the important thing for everybody to realize, at least from my perspective, I'm not going to speak for my other colleagues, first and foremost, this is about Carroll County. No issues in seeing other people get assistance in health and help, but the reality is this needs to be about Carroll County. I think there was some confusion, I guess is the word I'll use, back in the fall when there were discussions about this. If we look back at Carroll County's history, we go back to 1917, and I realize that's quite a jump for all of us, but we had 3 citizens that wanted to propose a hospital for Carroll County residents. Fast forward to this project, while it does help Carroll County residents, 10 of the 16 beds are required to be used for Sinai Hospital, so that is clearly not Carroll County residents receiving respite care in Carroll County. Also, when we look at this, I'm a little curious and vexed as to how we got to this moment on this project, because after we go back and look at the meeting and you review both the conversation and the motion, there clearly was some issues there where staff was outside remit as to how this came about, and that's a topic for another day. But given that, I think we're all challenged as to where do we go from here. But the reality is Carroll County does one thing best, which is look out for Carroll County. We've always come together, whether it was the power lines the other year, whether it's challenges in the community. I mean, Access Carroll does a fantastic job in what they do here. So this is not, for me, a personal issue towards Access Carroll or LifeBridge Hospital or anyone else, but this is a question of Carroll County first and foremost, looking out for Carroll Countyans. So with that, I'm going to leave that for this moment unless we want to have some public comment and go from there.
and I'd like to say a few words. Back in October, we voted on this. Evidently, there was some confusion. I wasn't confused. I fully understood the program and voted for it. And then, Roberta, we had said if anybody wants to do public comment, to get a card to you. And then there was so much misinformation about this put out by many people. It's about like the Board of Ed or you name it. It seems like the loudest people have the least facts, which is a shame. I look at this as recovery, respite, our hospital. To me, this is a Carroll County issue, and we need to. It's a typical NIMBY issue. I love helping people, just don't do it in my neighborhood, and that's sad for Carroll County. And it'll be curious to hear some of the facts about this, and we can certainly revote.
I want to start with a bit of a conversation because it was brought up. Staff was outside remit. I'm not sure what that means. Access Carroll does what they do best, which I agree with. And this project was thought of years ago. So if you use the term Access Carroll does what they do best, and this is what they do best. It's great to hear from the community. I absolutely agree that it is great to hear from the community. This is about Carroll County. You're absolutely right. This is about Carroll County receiving a $5 million grant through Sinai Hospital to allow Carroll County to take care of Carroll County residents. In the initial portion of this, it'll be folks coming out of Sinai Hospital. It doesn't mean that they're coming out of Baltimore City. It means they're coming out of Sinai Hospital into a hospice program. And it doesn't mean that they are villains, criminals, druggies, or vagrants that will, pop you, be all over Westminster or Carroll County. They're going to have case managers assigned to them. It has been proven through those that have gone through respite already that they have returned back to their residence. I think it's 5 out of 5, and there's still 4 that have assigned case managers. There's no crime associated. There's 24/7, management or security over those in the hospice care, is what I'm being told, or when the work will be done. It'll be a 24/7. The idea that businesses are worried about this, I don't know how many businesses from Main Street have moved because of this. I was told one business has moved. I don't know if it's because of the distillery building or Access Carroll, but, I don't know. So I'd like to know more about that, because the facility will have 24/7 security to prevent unauthorized departures and ensure safety. And I'm just taking this from the experts, like we all agree Access Carroll and LifeBridge are. Confusion, I don't know what the confusion is when we're talking 20 beds at most, and most of them, at the end of the day, will be Carroll Countyans. That's, in order for us to receive the grant to have vision and serve Carroll County, which I agree is our focus, we got to start somewhere. And that's why I wasn't present for the October meeting. I think if I was, I would have been very animate in approval, like the rest of you were, that we move forward in the intent of developing a respite care, medical respite, sober respite, and food pharmacy into the distillery building onto a floor that has been vacant. And going from that letter of intent or letter of whatever we called it to a lease was a natural path forward that we have done in the past, and I have done in my time in both running large organizations, the installation, this county, where I don't sign leases. And I give guidance to our staff to do what we believe is right. And as good leaders, we should be the backstop for our staff. So staff being remit, which I just don't understand what the word remit is, and I'll ask Commissioner Vigliotti in a minute because I don't know it. But I think the staff is amazing in taking our guidance. And I think, as everyone knows, there is a need to serve our community. Access Carroll has been doing this for 20 years. And honestly, I wish we could have this type of project in every one of our municipalities and everywhere we see appropriate. I don't see any confusion on this. So, and I'll stop there and probably comment in a few minutes after I hear some more that people have to say.
And I apologize, one thing I forgot to say, and you mentioned Sinai. My wife's had 2 hip replacements and eye surgery. They were all at Sinai. She's not a criminal. She is a Carroll County resident. And I don't understand the mindset of that, but again, and I just wanted to mention that, and I'm done talking.
Okay, yeah, thank you. I have a couple comments. First of all, this word misinformation keeps coming up. It was mentioned earlier by one of my colleagues, and it's been in a lot of emails. So for the speakers that are about to speak, maybe you can inform all of us in the room, including myself, where we received misinformation, or is the accusation that we were spreading misinformation. I think we've got the information. In terms of outside remit, I think what Commissioner Gordon is referring to is the process by which in October we spoke about a lease for approval or a letter of intent, and then at the end of January that turned into a signed lease that many of us weren't aware was taking place. And the comment that, well, we do a lot of leases in the county and we don't talk about all of them. Yeah, that's true. The county does a lot of leases, but there's only one situation and one issue that we've discussed as a body here in my 2 years, and that was the issue of October 17th. So is this an issue, a lease that the board has every right to be discussing? You're darn right it is, because we spent time talking about the issue, the topic, in October, and then it turned into a lease. So it's perfectly relevant for us to be discussing this. And, this issue of not in my backyard, all of Carroll County is my backyard. I'm a commissioner. I think this board had better be careful because not in my backyard is something every citizen has a right to say. But it sounds to me like more increasingly we're telling people that we don't care because it's not in our backyard. And that's not the right message. Carroll County is all of our backyards. And which is why, whatever issue it is, wherever it is in the county, we've got to listen to people's concerns. They have every right to speak up as tax-paying citizens. So I hope maybe some of what I've mentioned here can be addressed by some of the speakers. But as Commissioner Gordon mentioned, I don't feel that this lease is in the best interest of the county. And I have spoken to a lot of the people involved who are opposed to this. And to every single person I've spoken to has said, we're a great county here. Westminster is a great town. We will come up with some solution. We will meet the needs of Carroll County residents as we always have. And we're doing that now. And there are even existing beds in other parts of the county, from my understanding, down in the Sykesville area. So we'll figure something out. This isn't the board if, in fact, we decide to terminate the lease saying we don't care. We've never done that up here. I think that's important to mention. So I'll see what some of my colleagues have to say, and we'll get on to comments from the folks in the room here, and hopefully move on, and then move on again in trying to address what the need is and how we can do it.
Thanks.
Well, thank you, everybody. I wonder whether we might not do public comment first, or whether everybody would like to hear my thoughts, or I'm good either way. I mean, do we want to let the people who have come speak first, or?
Well, I'm
happy to-
gonna
yes,
still
okay, I'm sorry.
have comments, so.
My thoughts
so
were,
you can
the 5
feel free to
commissioners,
talk.
if they want, can open it up with comments, then we'll go to public comment, and then I'm sure we'll all have something to say again, maybe a motion, maybe not, I don't know. But yeah, no, I thought this was the right order to do it. If you don't want to speak, that's
Oh, no,
your
I
prerogative.
just wanted to make sure that we weren't, I just wanted to make sure I was aware of the order in which we were proceeding is all. So as Commissioner Guerin had pointed out, there's a lot of accusations of misinformation floating around, lots of I guess, for me, it's not so much a lack of or an amount of misinformation as it is a lack of communication. So back in October, when this issue was before us, we were approached by a group called Access Carroll, emphasis on the word Carroll. The data that was provided to us back in October was Carroll poverty data. It was Carroll ALICE level data. We were told that we had buy-in from community partners regarding this. So in my mind at the time, I'm thinking, okay, well, the mayor, the council, other relevant individuals who are community partners are on board with this. We were told that this program was going to have emphasis on, quote, the home community of patients. The home community of patients. And we were told that this was a pilot program, and in my mind, in all of my experience working and serving on elected bodies, a pilot program is something pretty small, pretty tailored, pretty specific. Now, in that time, and I'll come back to the issue of the letter and the lease in a moment because that is important and that does speak to the fundamental heart of the issue at hand. What I've learned since then by speaking to individuals associated with the project, trying to learn my best, this idea of misinformation and lack of information this morning, just as an example, and this shows you how difficult things are here. This morning, some of my colleagues have referenced the number of beds that are supposed to go into this facility. I've heard this morning, just alone, 16 beds, 18 beds, 20 beds. Which is it? Is it 16? Is it 18? Is it 20? The individual that I spoke to directly from Access Carroll, and I'm not going to throw anybody under the bus by naming names, she told me specifically that it was going to be 16 beds. And that 10 of them were required to be Sinai patients. And it was related to me that there was no ability to determine, to require that those Sinai patients also have to be Carroll residents. Now, even if, and the question I posed was, okay, well, is there the potential that we downsize the program, downsize the pilot program to make it more conducive to Carroll, to take into account the concerns that everybody's approached us with over the last couple of weeks? And I was told, well, that's really not what I want to do, because if we do that, you're going to be taking away the other 6 beds and not from the 10 that are required by Sinai. And of course, as I found out over the last couple of weeks, the community support that I thought had been gathered did in fact not exist. It had not materialized. And I think that's, this starts getting now into the fundamental nature of what it was that we were asked with doing that morning. You take all these things into account, all these things into consideration. We were asked that morning for a letter of commitment. And we can talk about intent all we want and where we thought we were going to go all we want, but the specific direction from this body was for a letter of commitment. Now, this is important to me for 2 reasons. The first being that the direction from the body was for a letter, and a lease was drafted and signed and executed without our consent, despite the fact that we had asked for a letter. That's number 1. And so in that sense, I brought up the point last week, but I did not make the conclusion until I had some better legal understanding that that lease that was drawn up, despite the direction for a letter, would have been considered ultra vires or beyond remit, meaning beyond the scope or pale of authority, and therefore it was void ab initio, meaning void from the beginning or invalid from the outset. Now, the second reason why this specific direction for a letter I felt is important, and I think this goes again to the heart of what we're talking about this morning, if we had drafted a letter and not gone with a lease, if we had drafted with a letter and not gone with a lease, I would like to think that there would have been more discussion about this, that we would have had better information earlier, that we might have been able to appeal to LifeBridge, to Sinai, to say, look, this is not working in its present form. Are you open-minded enough to change this? Are you willing to go back to square one to meet with the mayor and council of Westminster, to meet with the chief of police, the sheriff, the state's attorney, to meet with us to see if there's a different way of approaching this? But we weren't given that opportunity. We weren't given that choice. Again, beyond remit, beyond the scope of authority, a lease was drafted and executed despite our express direction for a letter. And to bring up October 17th's meeting again, my colleague up here specifically said, so what you're looking for this morning is a letter and not necessarily a lease. And it was confirmed that it was a letter that we were looking for. Now, no one is comfortable with having to discuss this. No one is comfortable with having to bring this up. And that's why that letter matters. Because if it had been a letter through the process of understanding what it was we were doing, we might have been in a different situation than we find ourselves in this morning. So it isn't just a question of authority. It isn't just a question of whether or not this is good for Carroll County. The entire process here, the entire process and how we ended up in this position today is also what's at question. Now, I certainly don't take away anything from Access Carroll or the work that they do, or Sinai or LifeBridge. I mean, goodness knows, people from LifeBridge know that I've been trying for years to get an urgent care into Tawnytown. They do good work, but none of that has materialized either. And it's not because they don't care or anything, it's because they have a lot they're contending with. And the same thing goes for Access Carroll. They're contending with a lot. But in a situation like this, where we are specifically talking about a group that calls itself Access Carroll, all of the data provided to us that morning was Carroll County specific, emphasis being on home community, emphasis on it being a pilot program. It's simply not what I thought it was going to be. And again, I come back to the fundamental heart of this issue today, being the letter and the lease. If it had been a letter and not a lease, and we had had time to properly discuss this and talk about this, we wouldn't be in a situation today where we're talking about authority and leases and whether we cancel or not. But how do we make this work for the community? Because everybody involved in this, whether it's the mayor, the sheriff, the state's attorney, the chief of police, we are all members of this community. And at the end of the day, if that's who we're serving, the community, my suggestion would be to go back to square one and start over. If LifeBridge is truly concerned about community, if LifeBridge is truly concerned about this community, they will have zero concern about going back to square one to working with the community, within that community, to find something that will benefit the community and which the community can agree on. And those are my thoughts this morning.
So if you talk about lease being the fundamental problem, then we're going to be talking two issues. One is a lease, and then two is the intent in moving forward. I equated a letter of commitment to a lease, and the lease was done in due process. It was signed in January, but it's not an overnight process. Were there problems in that? Sure, there's bureaucracy involved in that because of you're dealing with government and you're dealing with LifeBridge as an entity, not Carroll Hospital, but LifeBridge. So it took probably longer than others expected, and it does seem peculiar how it was signed the end of January as October to going to a lease. And I believe that our staff had that direction with no other intent but doing what was right. So, you talk a lot about Access Carroll, and, sometimes you say how wonderful they are, but then other times it's, well, they're trying to do more than what they're designed to do. And I'm like, this is exactly what they're designed to do. A pilot program is a specific program, and it's a $5 million program that Sinai Hospital presented to go through Sinai Hospital and to point out Access Carroll because of the skill set that they have. So it's very much a pilot program. 16 beds, 18 beds, 20 beds. I get confused, but honestly, 4 beds out of 174,000 people in Carroll County, I'm not as concerned, but I believe if it can meet the demands that we have And if it's 16 beds, it's 16 beds. So I got no issue with that. I'm not sure about the beds in Sykesville. I'm very familiar with the RSS in Sykesville, and this is not. So I'm not sure where we're talking, unless we're talking Springfield Hospital, but I'm not sure what, is in reference to that. You're absolutely right about NIMBYism, that everybody has a right. And we have the responsibility to listen to everybody regarding the value that they hold dearly, and that is their own community. I agree. Still don't understand remit words, but that's okay. The misinformation, communication, it could have been done better. And in having the conversation with LifeBridge, they came out with, here are the things you need to know. And either we're going to believe LifeBridge, which I think is a very good partner in Carroll County and in Maryland, or we're not going to believe LifeBridge. They say homelessness, addiction, and untreated medical conditions are growing concerns in Carroll County. The Carroll Respite Program offers a structured, secure solution to help medically vulnerable individuals recover and get back onto their feet. Carroll Respite is an initiative by Access Carroll in partnership with LifeBridge Health. A $5 million grant from Sinai Hospital will fund this initiative, which will serve both Sinai patients and Carroll County residents. Without this partnership, these vital programs would not be available to local residents. This program aims to reduce strain on law enforcement, hospitals, and emergency services, helping to keep our community safer. It is focused on those three things. It talks about medical respite, what it is, sober respite, which will help reduce police involvement and keep ERs open for real emergencies. I attended meetings with the Westminster Police along with the Sheriff's Department. Access Carroll was there, Social Services, Health Department, Citizen Services. I didn't see any of the Westminster leadership there, but I know I was there. And I know Chief of Police was there because of the concerns of this issue. And we're trying to figure out what are some programs to do to help with the medical and sober respite coming especially out of the brick and mortar, out of the hospital. This is an avenue to do just that. So I really appreciated the Chief of Police saying, hey, we have a problem. Let's figure out some ideas. Access Carroll stepped up, said, we have a solution through this pilot program, and we can make this happen. Above and beyond the fact that this effort was being thought at for quite some time. An example of a medical respite is a man recovering from foot amputation who needs wound care before he can be safely sent back home or into a shelter. It's somebody that you want to get out of the hospital, but they can't do the things necessary to care for themselves. It could be somebody, baby coming out of a NICU that, once they're out, and caring for that infant. Those are respite care. I mean, it's not this, I'm on the streets, I'm doing drugs, I'm in the hospital, I'm getting put out of the hospital, I'm going into respite care, and then I'm going to go back on the streets and commit crime or petty theft or whatever it may be. There's these myths that are out there, and LifeBridge did a good job in putting this together. I think they did it $1 late, or whatever it's called. People will be able to walk away from the program and onto the streets of Westminster. Not true. All patients have intensive care management with dedicated resources to ensure they have a plan to return their home community and other services. The facility will have 24/7 security to prevent unauthorized departures and ensure safety. No one will be dumped into the community, whether we believe that or not. That's what they're saying they will commit themselves to doing, and they've shown that they've done that in the past. They've shown that they've had case managers for these folks coming out of Sinai and bringing them back to the community. The program does not benefit Carroll County. The fact is that Carroll County residents will have access to medical and sober respite, helping local people in need. In fact, the sober respite is solely to support Carroll County residents. I mean, I can't make this stuff up. And this is what, LifeBridge is telling us. Why Carroll County? Besides the phenomenal leadership that Tammy Black has, her team at Access Carroll is phenomenal. But selected for expertise and compassion, Access Carroll has been successfully serving vulnerable populations for over 20 years. And I'll tell you, if you look at the statistics about how many folks go in and out of the distillery for care, it's staggering. It's amazing. And it's because they've been doing it from the last 20 years, a community that cares. Carroll County has always helped those in need rather than pushing them away. A $5 million investment, a grant from Sinai Hospital, will fund services that also benefit Carroll County residents. Nearly $4 million will cover the construction of the facility in the distillery building. The remainder of the funds cover operating costs and services. So it's not $5 million or $6 million or whatever just going to patients. It's $4 million of the $5 to go to brick and mortar. Without this partnership, these vital programs would not be possible for local residents. It keeps vulnerable individuals off the street and in a controlled, secure environment. And it goes on. The fact is, we're talking 16 beds. We're talking another tool in the toolbox that I've been fighting for ever since I've sat up on this dais. Part of MACO, part of every organization, we want local control. The distillery building is a Carroll County building. Westminster is one of the 8 municipalities of this great county. We have an opportunity for local control of helping those that need to be served most, and to turn our back on them. But then everybody says, oh, we're supportive of Access Carroll, and we got great relationship with Access Carroll. Let's do it. I mean, it's not even putting our money where our mouth is. There's no money involved. It's doing it. But those are the myths and those are the facts. Whether we agree with them or not, they're not my facts and your facts. They are the facts. And if you think the lease is the fundamental issue, and it's important to spend a lot of time on this, if you think the lease is the fundamental issue, we'll deal with that. But then if you believe that the intent of Access Carroll to develop a respite services and sober respite, then we'll deal with that as a second issue. And I'm prepared to do both, so.
I think you have some valid points, but I also think there's been, we've talked about rumors and, confusion or whatever words we want to talk about. I think there's also been some conflation of the issue here. We sit here and we talk about leases, we talk about letters of commitment. Well, a letter of commitment by definition serves as a preliminary step to show serious intent in a property and initiate negotiations towards a lease. It's not a lease. So words have meanings, and Mr. Burke, being our legal expert, would know that the difference between a lease and a letter of intent is quite substantial. But to bring up another point, and look, no one here is interested in turning the backs on anybody. I'm not going to speak for all five of us, but I don't think any of us have that intent or belief about anybody, be they in Carroll County or anybody else in our state or our nation. But let's just look at real facts for a second. We have a lease that says citizens of Carroll County. The lease states citizens. It doesn't say Sinai. But then if we want to look at another piece of information, and I know the packet you've got over there is all the Access Carroll information, which I have as well. Access Carroll missions and philosophy off their own website to champion health and provide quality integrated healthcare services for low-income residents of Carroll County, Maryland. Now, I have nothing, and see, what I'm finding really disturbing today is we're playing this whole conflate mindset of let's group everything together. What Access Carroll does is not the issue. The fact that they're good at what they do is not the issue. If we want to roll all this together, which makes no logical sense, we can, but that's totally pointless. The reality is their own mission statement states that they serve the people of Carroll County. Does that mean that I haven't been to Sinai Hospital in my life? Of course not. I've been to Sinai. It's a great hospital. I've also been to Johns Hopkins. I've been to University of Maryland. But the reality is this lease was not properly created. And I'm sorry, we have had senior staff tell us that the other day, if anybody has recollection of that statement, and I'm going to leave it at that on that comment. But the reality is, these are two separate issues. It's not, you're right about that. But this is not taking a shot at Access Carroll. This is not being negative towards them. This is not being negative towards LifeBridge, Sinai Hospital, or the rest. Because I don't think any of us up here believe that. And if we do, I would like to know which one of us does, because it's clearly not me. But, you know, to make the statement, and Commissioner Guerin said it best, we serve all of Carroll County. Now, and I'm not going to throw any names out here this morning, but I know there's been attitudes in the past from people that sat in these chairs. It's not in my district. Well, I'll take a call from anybody, and I have, whether it be my district, your district, or anyone else's. But the reality is, let's not conflate the issues this morning. Let's talk about the actual issues.
I agree with you. I just want to say I agree with you. But if there's people out there that are saying, call them out. I mean, call people out. I mean, come on. If we're going to talk about, well, somebody said, I mean, I'd like to know, because I get confused on the words conflate. I'm the village idiot over here that doesn't understand some of these, how we're legalizing this. But I 100% agree with you. Let's focus on this lease. We're going to end up getting rid of this lease. That's fine. But the intent is to take the second issue and how to use the $5 million pilot program to support and serve Carroll Countyans. Then let's do it. Let's just move forward. We got so much opportunity. I just don't want to see that honestly go to waste, because it will.
And
Because I agree with you.
yeah, I think at this point in time, in fairness to the public, we need to open it up to public comment. And just so everyone understands, there could be callers, there could be live people. It's 3 minutes. It's not question and answer. And then we will all get to speak, like I say, and make a motion or not make a motion after that. But once we close public comment, it's closed. It's, like I say, it's not a back and forth. And Chris, can you verify? I think we have a caller, but I don't think they're for this agenda item.
That's correct, sir. They're calling for general public comment at the end of our meeting.
Okay, thank you. So, Roberta, you're in charge.
Tammy Black is the first caller.
Good morning, Commissioners.
Morning.
And everyone here. I'm Tammy Black. I've been a resident of Carroll County for more than 50 years. I've raised a family here, and they all work here in this community that we love. I'm also the Executive Director of Access Carroll, a nonprofit organization that provides integrated medical, dental, and behavioral health care, and we're located in downtown Westminster. We love our location, and we love our community there. Our mission is simple: to care for the most vulnerable people and champion health. The Carroll Respite Center is an extension of that mission. This program will serve patients from both Carroll Hospital and Sinai Hospitals, individuals who are medically fragile, recovering from surgery, managing complex conditions, or in need of short-term recuperative care before safely returning to their home communities. These are not individuals who belong in hospitals or nursing homes, but they are also too sick for shelters or the street. So the respite center is not a hospital or a shelter or a nursing home. It's a bridge to stability. Patients receive medical oversight, intensive case management, and housing support. Our proposed site at the Distillery Building currently does include 16 beds. I'd like to provide clarification on the number that has been 16, 18, or 20. Back 4 years ago, the Board of Carroll County Commissioners allotted the space on the first floor of the Distillery Building. It has been vacant for a long time. It was vacant at that time with the proposed model of building a Carroll Respite Center there. And we had been allotted 9,800 square feet. That is in writing, and I'm sure you've looked that up. When we came back to the project to revisit it, the county folks who live on the other side of that space needed more space. So the project square footage was cut down to approximately 8,000 square feet, thereby reducing the capacity of beds down from 18 to 16. The reason why the number 20 is floating out there is because the grant that Sinai received said there should be at least 10 beds, but they have the capacity of up to 20. So that's where that is there. I will also clarify that 10 of the beds are, as one of you said, is for Sinai. 6 of those beds are for Carroll. And then the sober respite, which can have 4 to 6 patients, depending on their need at the time, is 100% designated for Carroll County residents. Why Sinai Hospital? First of all, they are a strategic, essential, and synergistic partner to benefit Carroll County residents. We need Sinai, LifeBridge's help and support in order to meet the need of this community. They've invested millions in us already, and they're willing to invest $5 million in us for this project, for both operations and capital, at no additional expense to this community. I also want to say in my remaining moments here that I'm urging you to please consider favoring this project to help our community and at least extending your decision to cancel our lease. Thank you.
Thank you.
Mitsuko Nakashima?
Yes.
Good morning, everyone. I'm Mitsuko Nakashima. I'm from Japan originally, and I'm currently a patient of Access Carroll Medical Respite Center. I have received master's degree in social work from University of Kansas. My healthcare field experience include long-term care, both nursing facility, assisted living, and hospice care. So my personal testimony to support Access Carroll is not just personal and professional as well. And just hearing the beginning part of the discussion here, it's not the question of the Access Carroll, their quality of care of 20 years, excellent quality of care in this county. And so I was thinking, okay, my testimony is to talk about how good that service is. And they're not questioning, but I still like to say something from a patient's perspective. Last summer on one morning, I had kitchen accident. I was rushed to Baltimore Sinai Hospital, and I sustained a 3rd-degree burn and some structural damage on my right foot. And I stayed at Sinai 2 months, 3 weeks plus. I had 4 surgical procedures, and they used an experimental device called wound vacuum to clean my wound. And they put a huge 8 pounds metal external flame on my foot, and it had 4 skin grafts. And my recovery at the hospital was more than I can say arduous. And I had my surgeon, Dr. Bibo, and his team came to my patient's room almost every day to take care of my wound. And before I was discharged, Sinai Hospital discharge planner came and said, go to Access Carroll. They have good respite center. So I said, fine. I was not familiar with Access Carroll. And to my surprise, they turned to be godsend, wonderful organization. Okay. And they organized, they coordinated their care with many different organizations. And my wound healed, and I'm ready to leave. And my diabetic condition was better stabilized at Access Carroll. And now Tammy is giving me support to have way to be discharged.
Please finish your thought.
Service. So thank you very much for your time.
Haven Shoemaker.
Good morning. So, first of all, I kind of take umbrage with the NIMBY remark. I mean, the sheriff and I wrote a letter, joint letter. I think we outlined some concerns with the process leading us up to today. I think we outlined some public safety concerns in that letter. Since I think we're the only two in here who are elected county-wide, I guess the whole county's our backyard. So, I kind of take exception to that remark. Having said that, though, I think you all have the opportunity for a reset here, and I think that was what Commissioner Gordon was trying to get at the other day. You had the lack of outreach, I guess, for lack of a better word, to the stakeholders back in October. There's the rather interesting timing of the signing of the lease after the city of Westminster chimed in, and the sheriff and I sent our letter over, and then the lease wound up getting signed. But ultimately, I've heard from the proponents that, this project can serve Carroll Countyans. Well, yeah, I guess it could, conceivably. Conceivably, we can all get hit by a meteorite too. But, the question is, how much service will be provided to Carroll Countyans? If they're going to service, and I read this, if they're going to service up to 100 folks over the course of the year, how many of those are Carroll Countyans that are going to need this level of respite care? Part of my concern is the issue of public safety. We've seen an uptick in crime from the homeless population that we have here now, and the seriousness of that crime. So, the city of Westminster is going to have to charge people, the sheriff's going to have to house them, and my office is going to have to prosecute them. That's going to be an impact, and as a consequence of that, of importing even more folks from outside the area, that's going to tax the resources that we presently have. So those are my concerns in a nutshell. Thank you.
Thank you.
Sharon McLaren.
Hey, while she's coming up, if it's appropriate, because like Mr. Shoemaker said, he's county-wide, may want the sheriff also to comment on
He hasn't put in a comment.
either amplifying his comments or,
No kidding.
No,
Put in a comment card.
I
that's
know,
all.
but my thought is it's like peas in a
Yeah.
pod. So,
Good. All right. Good afternoon, council members, or morning. My name is Sharon McClernand, and I'm honored to speak in support of the Carroll Respite Program. I am the Vice President for Population Health for LifeBridge Health, but I'm a nurse, and I've held many roles at Carroll Hospital prior to joining LifeBridge Health, including a leadership role that has allowed me to integrate much-needed services into our community over the years. For more than 40 years, I have dedicated my career to serving this community, building programs that provide care and support those in need, all without placing a burden on county or city resources, and with all due respect, all without bringing thugs to our community. My commitment is both professional and personal. My husband owns a business here in Westminster, and in this community has been our home for most of our adult life. I've raised my children here. I have seen firsthand the growing challenges of homelessness, addiction, and untreated medical conditions in our own community right here on our streets. Carroll Respite is not adding to these challenges. It is a real structured solution. I have attended multiple meetings with the County Systems of Care Work Group and Chief Ledwell of the Westminster Police, and I've heard the same concern time and time again. Too many valuable or vulnerable individuals are cycling through our hospitals, sheltered with dignity and responsibility. Carroll Hospital, too, has long provided funding and resources to meet the needs of our county. Now, with the support from LifeBridge Health and a $5 million grant, we have the opportunity to bring respite care, both medical and sober, to Carroll County residents and those temporarily in our care. And let me be clear. Case managers ensure that every individual from outside our county is returned to their home community when medically ready. Without this funding, these services will not be possible for our community. I have been trying for over 5 years to get these services funded locally. This is not a new concept for Carroll County. Carroll Hospital already takes behavioral health admissions from all over the state, including Sinai Hospital, through a statewide bed registry. These patients are treated at our hospital and released back to the communities where they came from, which again will be the same model for the Carroll Respite Program. Some suggested that this program is an outside burden. The truth is, if we do nothing, the burden remains on our police, our emergency rooms, our shelters, and our streets. If this respite does not happen in Westminster, these individuals will have nowhere to go. I urge you to stand by the commitment made to this program, or at least delay the decision so that we can continue to provide factual information to our community. Carroll Respite is not a service, it's a reflection of our values. Thanks very much.
Thank you.
Garrett Hoover.
Good morning, Commissioners. Thank you for giving me a few minutes to speak this morning. I'm here as president of Carroll Hospital, representing our 1,900 employees, probably Carroll County's largest private employer with a payroll of $135 million. Our mission is to care for this community and anybody who comes through our doors, providing real solutions to growing health concerns, and that includes homelessness, addiction, medical fragility. For 2 decades, Access Carroll has been a trusted partner, funded primarily by our hospital's foundation, $1 million a year. Some of you attended Access Carroll's anniversary celebration with us last month. Last year alone, they provided nearly 15,000 visits, preventing many at-risk individuals from overwhelming our already extremely busy emergency department. The Access Carroll team understands better than anyone how to care for these patients who are struggling with social determinant of health issues, factors that impact their well-being. The Carroll Respite Program is simply an extension of that work. Yes, there has been some miscommunication and misinformation about this initiative. We could have communicated better, certainly, including the intentionality of not using its name, the Carroll Respite Program, despite the fact that Carroll County would benefit from having it here. It's only through this $5 million grant from Sinai Hospital that would be able to bring these additional resources to the people of Carroll County. And I want to be clear, this is not a dumping ground. The patients who receive care at Carroll Respite are medically fragile, Some are elderly individuals. Some require oxygen. Some have medication management concerns, chronic conditions, people who may have been recently hospitalized and need additional care before safely returning to their home communities. You've heard case managers working on clear discharge plans, security working 24/7 to return these individuals to their home communities. Without this program, the very problems that some have voiced concerns about, people living on the streets, increased strain on public resources, etc., will likely get worse. At the same time, Carroll Hospital has transferred 730 patients to Sinai Hospital since January of 2023 for the additional care that has been needed, care that our community relied upon without question. And yet, when given the opportunity to reciprocate in a meaningful way that directly could benefit our own county, we now hesitate. My family moved here 5 years ago so that I could become the hospital president, and I've spoken about the pride that I feel in this community. Partnerships, collaboration that are strong. And yet on this issue, unfounded fears have driven divisiveness that fractures relationships between the hospital, Access Carroll, the county, the city. It's very unfortunate. We've been fully transparent from the beginning that this grant would benefit LifeBridge patients. On October 17th, this council supported a letter of commitment. We can debate letter of commitment versus lease. Letter of commitment received a 4-0 vote. But now faced with opposition, that support has wavered. But homelessness and medical vulnerability don't disappear with policy changes. If you withdraw this support, these vulnerable individuals will still be here in your community. And as your hospital, we still care for them, because in healthcare, we don't draw borders around our county. There's a sign at Access Carroll that says, "We care for everyone." It's a standard that they uphold. It's a standard that the hospital upholds as well. I would encourage you to do the same.
Thank you.
Thank you.
Karen Donaldson.
First of all, I'd like to thank the commissioners for giving us the opportunity to speak to you one-to-one. I don't live in the city of Westminster. I live in the suburbs, and that's what this is all about, as a couple of the commissioners have mentioned. We serve all of Carroll County, and I appreciate that you guys listen to all of us. I really think the commissioners need to seriously reevaluate what you've done in the past, specifically October, because mental health and addictions of all kinds are very challenging to treat at best and threatening at worst. I actually know of a person that was treated at Sinai Hospital. His name is Jeff Capel, and he was a Carroll County citizen, and he suffered, and he's now serving close to my heart because I knew this family. He's serving a life sentence for stabbing his wife to death, and he was discharged from Sinai Hospital. Mental health and addictions are serious, and we have many people that need to have that services in Carroll County. I would just passionately plead to you that just service us first, help us first, and obviously we're open to everything, but this lease that's on the table, clearly from what you stated today, there's going to be people coming from Baltimore, and I want to help everybody. I have helped fundraise for Access Carroll for years. They're a great service. Other people have spoken today, obviously, that are on the board. They're all very hardworking, very compassionate. Hopefully everybody in this room is compassionate. But the 24/7, which Mr. Rothstein touched on, that is just very challenging. It's apples to oranges, but Silver Oak, which is in your district, I think, Joe, the Sheriff's Department, the Taneytown Police, they've been out there a couple times. The people that run that program are very well trained, just like, I guess, the people that are planning on helping with this program. It's not working, for sure. And so I just ask you to reevaluate the process that you went through. Also, I do think the comment that Mr. Rothstein made in reference to Haven Shoemaker, and the sheriff was kind of uncalled for. So thank you.
Thank you.
Tom Welliver.
Yes, my name is Tom Welliver, and I'm the chairman of the board of Access Carroll. And in my day jobs over the last 8 years, my job has involved dealing with homeless, so I feel uniquely qualified in working with the homeless through HSP and Healthcare for the Homeless. So I'm going to say a lot of facts. I've been the last 2 weeks trying to beat down bad information, innuendos, no lies, but innuendos. Fact, $5 million is going to be invested in this community by the Maryland Hospital Association because they trust Access Carroll and Tammy Black to do what she said. She has 20 years of history in doing that. An uneducated response was that we have this golden carrot out there of $5 million. Well, if any of y'all have tried to raise $5 million, it's tough. It's allowing us to do this now and not 3 to 5 years ago when we can raise $5 million. We have 6 beds to serve our citizens. Yes, 6 beds, not a dream, it's 6 beds. We also have 4 beds to really alleviate a problem with our city and sober respite. Our police chief spent 20 minutes 2 days ago on the phone at a health department meeting, lamenting not having a place to take people with mental illness and find themselves intoxicated, so they end up in our ER. 6 beds that you can go to the ER now that'll be vacant, that won't be vacant if we don't have this. So yes, it is not a dream. It is 6 beds plus 4 more of sober respite that won't clog up our ER. It's been coined more mental health. This is a national playbook to give it a nickname. This is for people that have had gallbladder surgery, that have had the flu. You could die of the flu because you can't come to our shelter. Our shelter won't serve you if you need this type of care. Now the facts. I'm running out of time, but over the time that we've been running this respite program, 0 people have stayed in Carroll County. They've all returned to their home community. During that exact same time, 60 people have been dropped off, Ubered, or dumped on our shelters. 60. So we're looking at 0 over here that what might happen, or 60 that actually has happened in the last 6 months dumped in our shelter. This respite program can help those people get back to their home communities. So I got $5 million in this hand and a help for 60 people being dumped on this community, and I've got 0 in this hand of innuendo and things that could happen. It has disappointed me that some of the letters that were written and the gentleman that punched was deemed to be from not Carroll County, that punched the minister. He grew up in Carroll County, went west to Westminster High School, had a run-in with the law prior to that, but they had no place to take him. Months prior to that, he was having a mental episode, and had we had this respite, we would have had a place to take him that day, and he would not have hurt that minister. Thank you very much.
Thank you.
Thank you.
Betty Armacost.
Excuse me? I have trouble in the grocery store reaching the shelves, too. My name is Betty Armacost. I have been a resident of Carroll County, Westminster, Maryland, before almost any of you were born. Over 7
As we're willing to take this up and discuss it. The city was not involved at all in this process until about 3 or 4 weeks ago. We were not informed by anyone that this was happening. We got an anonymous call about a person being at the pilot program at the Best Western having an outstanding warrant. So it was we were asked to go out and check on this and send our police department out there to find out what the story was. We did that. The person did have an outstanding warrant. And then we became aware of this program. We didn't know this was going on at all. We were never part of the conversation. We were never told about it. We were never asked about it. We discovered it kind of by accident. So needless to say, we haven't had a lot of time to really dig into this, but it's very concerning for us pertaining to the Sinai Hospital part of this issue. We fully recognize the need for the service related to Carroll County residents. We support it. Access Carroll does a wonderful job. LifeBridge does a wonderful job. And we are completely aware that there's a need for this relative to Carroll County residents. The problem is to get it for the Carroll County residents, we need to make the concession to have 10 or so beds for non-Carroll County residents. And that's where the concern really lies. I'm going to give you a few facts that the chief planned to come speak about relative to 10 Distillery Avenue, which is where this is proposed to be and where Access Carroll currently has some programs. I believe HSP, there's some other organizations that work in that building. In the last 7 years, 2018 to 24, the Westminster Police Department has responded to 1,850 calls for service at that location. That's almost one a day. They've been included incidents from serious assaults to disorderly conduct, intoxicated individuals, destruction of property, and emergency petitions. This is very taxing on the city of Westminster to have these services in town. And I know there was an earlier comment that said a lot of these things go on and they haven't asked for any support from the city, but in fact, we are supporting this and it's very costly. As you guys know, a police department costs a lot of money, and we spend clearly 1,850 calls in the past 7 years just at that one address. And our concern is that's just going to increase with bringing all these folks in. If a facility was built for Carroll County people, it would probably be 6 beds, as Mr. Welliver said. And I think we all could agree that that is a manageable situation. But doing it 16, 18, 20 beds and having a whole bunch of folks that aren't locally, they're going to be bringing in all these problems for us to deal with. And they are not incarcerated individuals. They're there voluntarily, and they can leave. So let's just keep that in mind. Thank you.
Thank you.
Daniel Hoff.
As you know, I'm Dan Hoff, and a member of Westminster City Council. I live and work in the heart of downtown Westminster. So I'm up here today as someone who's actually personally impacted by this proposed project. So please consider these 3 critical points as you're making your decision. If this project as conceived was truly in the best interest of our community, Access Carroll and LifeBridge would have engaged with the leadership of Westminster in a sincere and collaborative manner well before they ever came before this Board of Commissioners in October. Instead, the leadership of Westminster, including myself, did not find out anything about this project until mid-January. If this project was truly in the best interest of our community, our local public safety officials would be in support of this project. Instead, every local public safety official of note who is actually personally responsible for the safety of the citizens that live, work, and shop in downtown Westminster are all unanimously opposed to this project. If this project, as conceived, was truly in the best interest of our community, our mayor and our council would be in support of it. Instead, the mayor and every member of our council is opposed to this project as currently conceived, as well as every member of our state delegation to Annapolis. The reality is that this project is not about what is in the best interest of the citizens of downtown Westminster or even, frankly, Carroll County. Rather, this project is more about cost containment for LifeBridge. I have been incredibly frustrated by this whole situation and the lack of transparency and collaboration when it comes to the city of Westminster regarding this project. I mean, we even have an unauthorized lease being signed by county staff once trouble is brewing on the horizon. What is that about? In conclusion, my hope is today this project as currently conceived is voted down by you all. And then once it is voted down, and once we've all had a chance to recalibrate, because I'm a little bit hot about this issue right now, I welcome engaging with Access Carroll and LifeBridge in a transparent and collaborative manner that would create a win-win for Westminster, Carroll County, and everybody in this community. Because there are a lot of great things Access Carroll has done over the years. But this project has consequences for the long-term viability of downtown Westminster and our community that I represent.
Thank you.
Sheriff Jim DeWeese.
Good morning. I had no plans of speaking, and Dan scared me a little bit, so I didn't know if I was going to get up here. But I appreciate you letting me get up and say a few words.
Thank God you're the one carrying the gun.
I know. I've spoken to all 5 of you at length about this project. The mayor, the council. There's not one person that I've spoken with that says that we don't need to help the folks that are in this community that are homeless, that need respite care. Not one. And as the 5 of you know, I put an awful lot of resources into Westminster City on a daily basis, work very collaboratively with the chief of police. I've worked out of 10 Distillery from 2000 to 2004 as a sergeant with the Child Abuse Unit. I worked out of that building. Social Services was there, so I know what goes on there. And the facts are there's an awful lot of activity that takes place at 10 Distillery. There's an awful lot of calls for service that take place there. So I guess the question I have is, I'm not here to argue whether respite care is needed. It's obvious that we need to help the homeless in our community, and if it's beyond and we can show that we can send people back to their home base and help them be productive, then that also. The question I have is 10 Distillery the appropriate place for this facility? The other question I have is, are we solving a Carroll County problem, or are we trying to solve someone else's problem? And if you can tell me that we're trying to solve a Carroll County problem, I'm on board. And I met with Tammy on Tuesday, and I've known Tammy for a number of years. Everybody will stand up here and say nothing but glowing things about Tammy. But I was honest with Tammy, and I told her that the marketing of this respite sucked. It wasn't marketed appropriately, and I'll be honest with the 5 of you, you didn't listen well enough when they came back in October and vetted this program appropriately so that all the stakeholders understand exactly what was taking place. Because after I talked to Tammy, I may have been a little bit more on board with what she was saying as a countywide elected official, as someone that's responsible for safety and security, also in Westminster and every jurisdiction. But I think if lease, no lease program, grants, no grants, if we can reset, as Councilman Huff so passionately said, if we can reset, go back and let Tammy and LifeBridge explain how this program is going to work. Let's question back and forth, because I got a lot of questions and a lot of answers from Tammy on Tuesday that really satisfied a lot of what I was saying. But I don't know at the end of the day if 10 Distillery is the best place for this program, because there is a lot of activity there. It will put extra burden on the chief. There is already security there. They're observe and report security, and the police has to come and deal with the issues. So I'm asking for the 5 of you to look at the lease, look at this entire program, and maybe reset so that we can go back and talk to the mayor, the council, and all the stakeholders and decide if 10 Distillery is the best place. If the program is viable for this community, are we solving a problem for this community? And if it is, where does it go? And is everybody on board with how it gets put together? And I think everybody will be more successful that way. So thank you.
Thank you.
That's all.
That's it. And Chris, we have no more callers, correct?
That is true.
Okay. Commissioners, how do you?
Well, except for the sheriff saying 5 in October, there was 4 of you, not me, so keep it at that. We've been transparent from this. No. I don't understand what cost containment is, but I'll look that up. Yeah, I think going from where we were collectively in October to where we are today was clunky at best. And there's obviously enough concern about the lease and how that moved from a letter of whatever was agreed upon to a lease. You know, let's deal with that. let's also deal with what do we want as the intent in moving forward. And that's why I appreciated not making these conversations, because we got a lot more input and insight last week, and we were able to do it today. So we separate them because we want to be transparent in everything we do. So it's kind of sad that somebody says we're not. I don't know if there's a sunset on the grant. I have no idea. The $5 million grant. I hope there's not, and hope is my only course of action because I don't know, but I'd like to find out because I hate giving money away. We seem to be able to give money out sometimes pretty easily, but I hate giving money away, and especially when it's $5 million for a pilot program. Councilman, I appreciate the number 1850 past 7 years, although it wasn't yours, it was your chief, so I'll give him the credit, not you, but that's huge. I didn't know. No, a lot of insight that was provided. Yeah, I don't know where the word thugs come from either, unless that is what the respite is, pushing out, but I don't think they are. But again, I'm not there to see the discharges of those in the respite. 16 beds. Let's keep it at that. I think that's the number, the magic number we're talking about now.
Oh,
So
but they
there's
did, not to
no
cut you off, they did mention the 4 sober, or the 4 to 6 sober, so it is technically 20 or 22 in that inclusion plus the 16. I was told that yesterday in a meeting, and Ms.
And let's
Black
stick
did just
to
mention
22.
that.
Let's,
Fine.
whatever number it is.
Okay, it's 20 then.
And I'll be honest, I don't want to decide how many beds they
Yeah.
ought to have.
Okay.
I don't
care.
I'm just saying.
I
Let's.
don't give a crap whether
Right.
it's 15 or 25.
I know. I'm just saying. Let's stick to a number, and it's not a number to dive on, because the difference between 15 and 25. As far as stakeholders, and then I'm gonna shut up. As far as stakeholders, it's county building. There's county services, there's state services, there's nonprofit. It's seated in the city of Westminster. What other stakeholders should be engaged? Should be the Chamber of Commerce? Is there a community activist group right there? Should it be all the municipalities? Because, like MML, because we're serving all of Carroll County. Where do we draw a line on stakeholders? And that needs to be defined, because if we don't, the next thing we're going to deal with is somebody says, well, I didn't know about this. I went to the 20th anniversary with Commissioner Kyler, and they had the layout of the respite care. So I've known about it for quite some time. So for people that didn't know until January, you're right. It was clunky, there's no doubt. But I think we're going to be making 2 decisions. One has to do with a lease, and then the other has to do with what's our intent in moving forward. So that's kind of where I'm at.
And I don't want to say a lot. I apologize if my NIMBY offended people. When I was born in Carroll County, I think there was less than 50,000 people. And I'll be honest, if I had the same attitude that the current people that came here, the population would probably be under 100,000 instead of 170,000. But I always said, if you own that farm next to me and you decide to do 200 houses, my choice is buy the damn farm or let you do 200 houses. But that's my personal opinion. And yes, I care about all of Carroll County, and I don't think that's a question. I do think the paperwork of this has been more misinformation. Anybody that's done a lease, if in October we said we were supporting this and staff decided in a month that our support would lead to a lease, that's November, and no offense to LifeBridge, but they're not a small organization to go back and forth and negotiate a lease with them, take some discussion. And I don't think there was anything nefarious about when it got signed. I don't think the people negotiating the lease probably paid a lot of attention to the public comment. They were moving forward from what it was. So I think, and we can get into paperwork, but the biggest deal is today, and some people said reset, some people said stop the program. And I think we need to make a decision. Are we in favor of or against, or we want more information and maybe something different would be better? I think that's the decision we need to make today, personally.
Well, I have to say I'm a little disappointed that, one, we had to get into NIMBYism today. And I'm going to bring up something that some people that have been around Carroll County long enough know. Some people believe that if you got off at Plymouth Rock and walked here, you were the only Carroll County residents. That's not the case, in my opinion. I don't care if you moved here last year. If you're an active person in this community and you help this community and you're involved, whether it's nonprofits or whatever, you're Carroll County. And I'm not going to sit there and label you because you showed up last week or 200 years ago. But I have to say, I'm also disappointed. Yes, there were some comments that I'm a little frustrated about. I don't think everybody that's coming here is thugs and criminals and all that. I think that's gotten beyond the pale. Are there people that ended up here that maybe have criminal records? I'm sure there are, because we have the facts to prove that. But like the one woman that spoke, and I appreciate you speaking about your health care, there are, I'll use the word typical citizens that are in need of respite care. We shouldn't confuse the two. And, you know, to Mr. Hoover's points, talking about partnership and collaboration, I agree. We need that. That's what makes Carroll County great, when we all get together and work together collaboratively. Now, clunky might not be the exact word I'd use, but we'll go with that on this lease and all the process that's been brought up to this. But for me, when we look at the numbers and the facts, 62.5% of the beds would go to Sinai. 37.5% of those would go to Carroll County residents. That's not Carroll County. And I understand where Commissioner Rothstein's coming from with the hope that we can maybe figure out a way to keep this process moving forward for that $5 million in funding. And I agree with you. I would like to see that if there's a way to do it. Hopefully there is. But as you've told us for the last 2+ years, sir, hope is not a course of action. So hopefully we can find a better way to get there together. What I'm going to recommend this morning, and yes, technically this is 2 issues, and I'm going to make 2 separate motions if everybody's okay with that. But what I'd like to see us all consider, and I'm going to say this and then I'll make the motion, I think we need to have a serious collaborative conversation, not just this body, not just LifeBridge, not just Access Carroll, bring in law enforcement and bring in those other community partners and do what Carroll County does best, which is work together. We can point fingers and we can argue and debate this all day long, what it's going to do, what it's not going to do. I don't want to get into that nonsense. Let's do what Carroll County does best and what we need to be doing. Because, you know, we live in a country right now that even before the past election, we've had a lot of discourse. And you know, the one time, and I don't know about the rest of you, but the only time recently that I was like, wow, this is who we are. This is who we really are, was that so-called meeting at the Senior Center by the power company where everybody showed up. It didn't matter if you were a Democrat, Independent, Republican, you lived in a cul-de-sac or a 200 generational acre farm, you showed up and said, hey, I'm Carroll County, leave us alone. So I agree with you, Commissioner Rothstein, about local control. You and I totally agree on that. So with that, I'm going to make a motion that the Board of County Commissioners cancel the Access Carroll lease for January 1, 2025 for respite care serving Sinai and Carroll County residents. That's my first motion.
Second.
We have a motion and a second. Any discussion or questions specific on the motion?
Yeah,
What's going to be the second motion?
Well,
You mentioned you felt there was a need for 2 motions.
I think I know what the second motion is going to be, and I don't know if it's going to be necessary or not. I hope we're I think a lot's already been said. I just seconded the motion. As has been mentioned several times, let's do a reset. I have commitment. I've seen the Westminster Town Council. I've heard it with my own ears. They're committed to working something out. Let's look to the future. Let's figure out what works best. So as much as this seems like a negative, let's turn it into a positive. And there is a second to that motion, correct? And that would essentially, if I may, just direct our attorney to send a termination letter. Is that right? Okay. So second, there's a second here.
So
Like I said, just the discussion, I think we're going in the direction we want to go. You were like on a roll. And I just wanted you to finish your train of thought.
Okay.
On what you're.
Well, we have a motion and a
We have a
second there, so we at
motion, so-
least need to
yeah.
do something with that before technically we
Yeah.
can move on.
Oh, okay, yeah.
I would like to just throw a couple more thoughts out there. And I know they may not all be totally specific to the motion at hand, but I think that they're, appropriate. A lot of what I'm about to say has already been said by my friends up here. Yet one of the comments that was made during public comment about hesitation or caving to public pressure, that's, our job as elected officials at any level is to listen to concerns from the public. Yes, there's going to be pressure on any number of issues, but that doesn't mean you necessarily cave to something if you end up agreeing with what is being said. Sometimes, and I will speak for myself here because everybody knows I know enough to know that I do not know everything. I'm not afraid to ask questions. I'm not afraid to admit that I was wrong about something. I've done it before. I will be doing it again. That's simply in the nature of anything because we are all human. To be human is to err. And as elected officials, part of our decision-making process is to listen to concerns from the public. That's not caving to public pressure. That's doing our job. Now, the second thing, as has been said up here, and even among members of the public today who were present, start over. The debate isn't about the need or the service, only the process and the method by which it is being done. And I think in and of itself, that speaks to the integrity of this community, that even people who have every right to be completely angry and upset about this are still trying to find the right way forward with this. And that's, again, why I brought up that letter earlier. If we had had time to discuss this, we might not be where we are in the place that we are today with this. We may have found a more amicable and peaceable solution prior to this. Again, I really cannot emphasize that particular point enough as well, that again, even despite the concerns over this from the community is still looking to find a way forward with this. And that's all for me.
Any further questions or discussion?
No, I think it's going in the direction we want it to go, so, yeah.
So if you vote in favor, you are voting to cancel the lease and send a letter.
Yep.
All those in favor?
Aye.
Opposed? Okay.
And now to my second point, which, thank you, Commissioner Rothstein. As we've all sat up here and talked about this today, it's important. Let's not, I don't want the conversation of thugs and all these other things that have kind of come into this conversation to remove the importance of what we're talking about, which is helping people. That's very important. We all know that. So what I would like us to do, and what I'm going to make a motion on, is that we will reset this. I'm not going to call it a reset, but we will start this conversation over, because I do think it's in the best benefit of the Carroll County residents and people in general that we figure a way collaboratively together to accomplish that. Now, will it look like it did with this previous lease at Distillery? No. But I think we need to sit down and do what we do best as Carroll County residents, which is work together for the people of Carroll County, whether it's elected or it's people volunteering and rolling their sleeves up. That's what we do best. So my motion is that we create and set up a time to collaboratively work with both LifeBridge, Access Carroll, Westminster City Council, law enforcement, and other entities of distinction that need to be included in this process to move this forward, to look into a Carroll respite opportunity and create a lease.
Second.
We have a motion and a second. Any questions, discussion?
It'll be open to the public.
Yes, absolutely.
Should we, again, this is important. This is great. I mean, it's meeting the intent that I think we all want. Should we either commit to or give a, like, hey, the next 2 months, 3 months or something, and get it on the calendar to move forward? I mean, there's momentum.
No, I agree with you. That's fair.
So if we go back to Access Carroll and all those involved And I didn't realize it was unanimous. I thought it wasn't quite unanimous in the city, but that's regardless. Whoever wants to be engaged, give them, say, 3 months or something. I don't want this to lose.
No, and I agree with you. I agree with you.
So if you, say, amend it in no longer than 3 months from today's date.
Today's what, March?
Basically.
February?
Right,
I seconded the motion, so obviously I support the idea. We might run into some dangers trying to be too specific. I think individual commissioners should get involved with this working group or this issue as much as they deem necessary. But I have every faith in the people that are sitting out here to come up with a solution to what this issue is involved, whether it's at the distillery or not. So, I mean, as long as these folks are involved, the 5 of us can get involved, I think, as much as we'd like. I still support the motion, but I would caution about getting too specific. After all, really, this is just our space. I mean, this is why we are discussing it now. Maybe the iteration of this isn't in our space. So how much do we really want to get involved? I think it's up to individual commissioners. So so I'm very comfortable with the language that you put forth, but I completely understand with Commissioner Rothstein. He wants to make sure something happens, and I think that would be incumbent upon the 5 of us to just make sure we get involved and as much as we'd like to and as much as we feel necessary.
And I think to your point, the reality is the 5 of us are sitting up here having this conversation. We've had conversations about this over the last several weeks, several months, whatever. But the reality is I don't think any of us are going to let this fall through the cracks. It definitely is not going to be for me, so I think we should just leave it as is.
I don't think it is. I just don't want. I don't think it is. I want to establish the framework. So if we say in the next 3 months or 4 months that we will have the initial work session.
And
so, I mean, that's all I'm thinking. I mean, I agree with you. I agree with both of you. I want this to move forward. So I'm just.
And I understand, and I understand the
some
motion
framing on it.
and the wording, I think, is already too specific. I think one of the things we need to understand is LifeBridge and Access Carroll may say, I'm going to do this in Ellicott City. I'm going to do this at Pantherplex and Hampstead, which you're most welcome to consider. They may not want to pursue this any further because of the grant or whatever. So I think it's also going to be on their side of the fence.
Absolutely.
If I'm in their shoes, I'm tempted to say, we've only talked about this 3 or 4 years, and now everybody's in a panic in a month, and I'm done. But that's totally, and that's not a question, but that's totally up to you guys. So we can't force them to discuss it, but hopefully they will. Any further questions or discussions? All those in favor?
Aye.
Opposed? Thank you. Thank you, everyone.
you.
On both sides. It was
Yes.
good conversation. And I hope I didn't offend law enforcement or the state's attorney too
I hope
much.
you did.
You'll know when you leave here in your car.
I kind of knew that. That's why I said something.
I didn't park next to him. We're good.
Priority Carroll, and I think we start with Commissioner Guerin, but who knows?
Okay. So I guess I'll be
Wait a minute.
I'll be quick. Yeah, I'll
Allow
wait a
them to
second.
leave first,
Yeah,
or?
I'll let everybody depart.
That's flurrying.
Thank you.
Thank you.
Yeah.
Thank you.
You know, been here 70 years, but when you reach 90, let everybody else.
Was good seeing you.
Yeah.
Didn't you know a former county commissioner?
And Director of Public Works before that.
I believe so.
That was enough.
We built a lot of roads, and I don't mean it negative. We had to deal with him as Director of Public Works, maybe more so than Commissioner.
Yeah.
Yeah, interesting guy.
It was the time of the hurricane that wiped everything out.
Yes, oh yes.
Just
retired from the state highway at that point and had good connections with the federal government that other counties did not have. So we accomplished more here.
Yes. And probably Mr. Burke wasn't county attorney then.
So, I don't think so. Yeah.
Thank you.
I could have
Good
saved
seeing you.
myself from being an
Thank
attorney
you.
at that
Take care.
age.
Thanks. Thank
Sure.
you. Just a few announcements. First of all, I want to mention again the job fair on February 27th at the Carroll Tech Center. It is a law enforcement, first responder, and military open house for anybody, any students in middle school and high school. So I will say again, please get your son or daughter, grandchild, grandson, nephew, niece to that fair. You will find a lot of opportunities. I think whoever attends it will be excited about the possibilities here in Carroll County. I also want to thank the Rotary Club of Mount Airy for having me out a couple nights ago. I was able to speak with everybody. Not surprisingly, the main topics were MPRP and Blueprint. You know, Rotary clubs, for people who don't know, are particularly effective groups because you've got all these business people coming together who actually know how to get a lot of stuff done, and then you have them pursuing different philanthropic efforts. So, again, I want to thank Mary Jo and the Helmuths for having me out there, all folks that I've known for quite a while, and I really appreciate what they do, and they're very focused. You know, lastly, last night, President Trump signed an order, which is a long time coming. He signed an executive order last night ending the use of taxpayer money for federal resources supporting illegal immigration and illegal aliens. I've mentioned this topic a few times. I am fiercely loyal to Carroll County citizens. They have every right to expect all the services that they pay for because they are paying for them. They are taxpayers. Later this week or over the weekend, I will send a letter to our county administrator asking her to ensure that we are not in violation of that order. I know it's not, maybe it's not federal funds, maybe it's county funds, but I want to ensure that whatever we're spending here in Carroll County is going to Carroll County residents. We just had that discussion. So I think a lot of people who live in this state, in this area, like to think that, well, we're really disconnected from federal government at this point because they're not at all in favor of it. Last time I checked, Maryland is a state, and last time I checked, Carroll County is still part of the United States of America. So I will be asking the county administrator to conduct a review and ensure that we are in compliance with the letter of that law, whether it is a federal law or not. I think it's important for people to know what their money is going towards. And that's all for me.
Thank you.
Good morning. First and foremost, I just want to say thank you to our staff. I know we've had people the last few days that were expecting massive amounts of snow, and we didn't get it, thankfully. But we're getting some apparently now. You know, we have a great staff from the county. I mean, these folks work 24/7, whether people realize it or not, and are definitely looking out for our best interest as a community. And yes, sometimes you think snow's coming and it's not, and sometimes it is. But just, you know, if you see any of them around, thank them. I mean, yes, they have a job, and yes, they're employed, but these are great people. These are people that really put their heart and soul in their jobs, and we are tremendously grateful to have them working for all of us that live here. Real briefly, wanted to mention Monday evening, myself and Commissioner Kyler were at District 5 night in Annapolis. It was a good evening to see our delegation. Not all the conversation was ideal given some of the happenings in Annapolis. I'm going to skip over some of that. But it was great to have food catered by Outlaw Barbecue in Hampstead as well as Rocco's. And just a good time to get Carroll County residents together. Here you've got myself with Cameron Livesey, which is the young entrepreneur of Soul Man Sweets, who's also a philanthropist. Cameron last year was the youngest participant at Taste of Carroll. He'll be there at this as well this year. But just a good time to interact with the community. And it was good. I think it was great for the delegation. I think it was good for all of us just to have those opportunities, to have some of those conversations in a much more, I guess, relaxed area, so to speak. On Tuesday, I attended the Board of Zoning and Appeals meeting. And then yesterday, I was in attendance at the Historical Society of Carroll County's board meeting. And that's it for me.
Oh, thank you, Commissioner. Good morning, everybody. I'll be very brief as well this morning. Everything that is, I'll start with that. I had the pleasure to attend the Master Plan District 1 open house yesterday in Tawnytown at the library, which was graciously hosted by the library. I was well attended, and I want to offer compliments to everybody from the county who designed, set up, and manned the open house. They took questions, they provided information, and above all, they listened to what our citizens had to say. I really cannot commend everyone enough who was there yesterday for their kindness, their professionalism, and for representing our county so well. I am beyond impressed and certainly would never have expected anything less than how wonderfully they did. So the other two very brief things I will touch on. The first is that we all have been receiving a tremendous number of emails at present, and it makes responding to every single one of them difficult or even in a timely fashion. But please know, if you have written to me, I am doing my best to read everything that does come in, even if I'm not able to respond to every individual thing. And then the second thing I'll mention is that the Maryland Public Service Commission has very graciously extended the deadline for filing for intervention against PSEG and the MPRP power lines to Monday, February 24th, 2025. And so if anybody's interested in intervening in that case, when you do so, you have to make sure to reference case number 9773. Again, that's case number 9773. And that is all for me this morning. Thank you.
And,
yes.
And you can do it via e-file or mail.
Yes.
They won't accept emails.
Yes.
You found that out, right? So, MACO, Maryland Association of Counties. I participated on Monday evening with the rural counties, the 16, jurisdictions around the state, to talk about the different legislation, and make sure that we're on the same sheet of music. Then yesterday, Commissioner Kyler and I participated in our respective subcommittees and then the legislative committee yesterday morning. Like Commissioner Vigliotti said, we are receiving a lot of emails regarding the CCPS, the school system budget, what was recommended by our superintendent, what was then recommended or actually approved to move forward to the Board of County Commissioners. The budget from the Board of Ed, and so we're receiving a lot of those emails. I'll share with you that anyone who is saying that they're from Marrittsville, Eldersburg, or Sykesville, I am doing my best to address you directly. If you want to be addressed directly, please let us know where you're writing from. It makes it that much easier. If not, what you end up doing is you're sending it to 4, 5, or 14, depends on the grouping, and you're not asking a question, you're just making statements. We want to be responsive. So in order for, at least for me to be responsive, I'm looking for that, hey, I got 2 kids in Sykesville Middle, or somebody in Century, or somebody in Orms, or someplace, and I'm like, oh, okay, let me address this specific. And I think we're all trying to do the same thing. Just appreciate that, and really do appreciate the emails and conversations that you're, and thoughts that you're providing. It's going to be difficult times, there's no doubt, but definitely we can't do it without you collectively, so your insight and thoughts mean everything. And that's all I got.
Okay, and I'll just run down a quick list. Hopefully, since last meeting, we've had Valentine's Day, and it's just nice. Anything that's family-oriented is great. Wrestling's going on. It's postseason now. South Carroll High School won the state dual meet title for the 4th consecutive year. They've been a traditional power there, and appears will continue to be. We also celebrated President's Day, and Commissioner Gordon mentioned District 5, District 42 in Annapolis Monday night. It was a great crowd, a very mixed crowd, and I think on Facebook, someone taped Delegate Stanko and his talk on the Board of Ed money, the Carroll County Public School money and Blueprint, and he did a very good job of summarizing how it's going to work out. And some of the emails we're getting, again, a lot of them have very poor facts, which is understandable. The budget's hard to understand, and they don't. But I see a lot of stuff of we didn't prepare for Blueprint. Carroll County Public School System and Carroll County itself probably was the first school jurisdiction to question Blueprint, predicted where it was going to be this year, and some of the other counties are now seeing it. So Carroll County did try to do their best to prepare for it. And again, if you listen to Delegate Stanko, he'll tell you, and everybody's predicted class size, educators not getting proper raises. It's like most things out of Annapolis, they totally underestimated the cost, didn't much care about the cost, and unfortunately, one of the big deals of original Kerwin group was educators and fair pay, and they only care about the starting pay. There's educators with 10 and 15 years that may not get steps or raises because money's being spent on Blueprint. And the only other thing I'd like to comment, we do not control how Carroll County Public Schools spends their money. We control the amount of money they get, but if they choose to get rid of certain teachers or ADs or whatever, if they choose to, we don't control that.
Can I also say, you only control about half of what they get. The
Yes.
state controls the rest of it. just
Yes,
so-
yes. Yeah, when you look at the
important
money they're
point.
getting, it's a lot from the state,
Mhm.
and we could get into maintenance of effort and what Carroll County's done, but the state, because of enrollment, shorted Carroll County Public Schools for several years because of enrollment. That's their formula. Carroll County didn't. Mako, we've had good meetings with that, and the session's all but half over. It's going to be interesting. None of the delegation wants to hear it, but this just seems like a year that they're going to extend a session. And they're not going to be done when they should be done. It'll be curious. Veterans Advisory, that meeting was this week, and that was a great meeting. Carroll Community College, their trustees meeting was this week. That was a great meeting. They've developed a budget. And the Ag Center Board met this week, and that was a good meeting, and busy time of the year.
Yes.
But a good time. I just want to touch again on our first item today of Access Carroll. Like Board of Ed, like Mako, like that issue, we listen to everybody, and we may have different opinions. We may have different opinions than individuals that were here today do, but we listen, and I still think one of the strong suits of the current Carroll County Commissioners is that we're not all mirror images of each other. We're very much different, and that leads to some interesting discussions. Okay, item 3, legislative update. Is she online or? Okay.
Good morning.
Good morning there.
Hi, how are you all today?
Well, thank you. How are you?
I'm okay, thank you. So this morning, I don't have the PowerPoint presentation, but I will follow up with that, and you'll get that in your email inboxes soon with more details about some of the bills that I'm going to go over today. As you just heard, we are at the midway point of the session, and I've also been hearing lots of talk of the possibilities of a special session in the future. One of the main things that is going to be discussed the rest of session and likely the topic of any potential special session is the budget. And a lot of this uncertainty is obviously because we don't know what's going to come down from the federal government that'll exacerbate the already large deficit that Maryland's trying to deal with at this point in time. So what we've been hearing is that there's really no significant budget action that's going to be expected until a little later, like mid-March in session, because they're trying to wait to see as much as possible what's going to happen from the federal government. But if we don't have clarity enough at that point, the situation will likely have to be handled with the information that Maryland has to date, and then any potential changes will have to be modified with a potential special session. So that's kind of where that topic has been floating around, and the idea has been that it may be something that would happen in May or June. And the timing of how long it would be is really, to be determined. And it's not certain. It's just speculation at this point, but likely depending on, what happens. But one of the important things related to the budget is that we need to continue to be aware and anticipate any last minute decisions and be available to advocate for the local impact of any of these decisions. So, as we're hearing things, I'll bring them to you, but if you're hearing something, please do reach out to me as well so that we can make sure to weigh in, whether it's verbally or in writing or by just making phone calls about any potential fiscal impacts that could trickle down, because that's really the nature of what's happening. Things are coming down from the federal to the state, and then the state's not having a lot of places to go, and more things, as you know, have been floated as potentially coming down to the local government. So we just need to stay vigilant on that.
And Pam, if I might real quick.
And in a,
I'm sorry, Pam, if I could just real quick, I apologize. I just wanted to say thank you to you on that note of letters and keeping track of bills. I wanted to thank you for all of your help this past week with keeping track of a number of MPRP related things, and I want to thank you for all of the time that you put into that. So thank you very much for that.
Oh, it's my pleasure. And that's something I was going to bring up later. Commissioners, if you have not yet contacted me, please do to let me know if you'd like to sign on to the 4 letters that I sent to you earlier this week so that I can get those out to the committee members. One of the things that you'll see in the packet that I'm going to send to you is a summary of all the bills that I brought before you and probably a few others and where they stand. And most of them either are awaiting a hearing or awaiting a vote by committee. So it's still not too late if you see something come across that we've talked about that you want to weigh in on. It may not be an official letter of testimony for the first bill hearing, but there's always the opportunity for crossover hearings, for cross-file hearings for bills that have been in one house that are going to be heard in the other. Or even just sending letters to committee members to help influence votes. So there's a lot of opportunity. Please continue to reach out to me. I'm happy to put together as many letters or make calls as necessary when something's important to you. The letters that you're talking about relate to 4 different bills. There's a few others as well that we may choose to also add to the package at some point relating to energy and different important issues. I'll just go through those now since you brought it up.
Sorry to have jumped the gun on you there.
No, it's okay. I have the notes here so I can make sure I don't miss anything. 1224, it strengthens forest conservation in energy projects, and it supports requiring stricter environmental reviews for new transmission lines under the Forest Conservation Act. The goal is to protect rural forests and wildlife from fragmentation and destruction that can be caused by large energy infrastructure projects, similar to the Piedmont Reliability Project. Another piece of legislation, which is House Bill 1329, strengthening Maryland's energy independence, advocates for increasing in-state energy generation, including natural gas and nuclear, to reduce the reliance on external energy sources. It supports empowering utilities to develop these local energy solutions to reduce the needs on these larger projects like the Piedmont project. H. Bill 1397 calls for the Public Service Commission to prioritize advanced grid enhancing technologies and consider this before approving new transmission lines. And the goal is to modernize the state's energy grid, but minimizing harm to rural communities and ag land. And then the 4th bill in the package that you have letters about is H. Bill 1406 that requires environmental impact assessments and reports before approving energy projects. It enhances public notice and involvement in the process to ensure more transparency and community input, and prevents the PSC from approving projects without a full evaluation of their environmental and community impact. So each of these letters tries to address the different reasons that you would potentially support these initiatives. If you have questions once you've looked at them, just reach out to me individually and I'll be happy to answer them. Or if you can just let me know yes or no via email, that would be wonderful so that we can move that package forward with those of you who do want to support it in official writing. Just going back for a minute before I move on to any other bills to funding issues, this was touched upon earlier in some of your comments, but the blueprint continues to get brought up and is an area of concern. There was even some discussion at the MACO Legislative Committee meeting of frustrations with, everyone recognizing how much of a fiscal burden this is in light of the budget issues, and trying to find champions who may be willing to speak out to make some more drastic changes. The beginning of session and right before session, we kept hearing the blueprint is here to stay, the blueprint is here to stay, and it probably is, but there may need to be, and everyone's recognizing it on the people that are actually involved in implementing it, some larger looks at, how this is moving forward, because it's a huge part of this financial piece of the puzzle that we keep talking about. So continue to advocate and speak up about that on your own, and talk to me if you have ideas. I have a couple, and it's something that I'll reach out to you as well offline about some things that we may be able to do. But I think it's really important to just keep speaking up about these issues, because it may or may not be something that gets addressed this session directly, but it's not going away. So the more noise you make, I think, to talk about how this is impacting Carroll County, other counties are going to do the same thing. I think we'll see more hopeful progress to revise the situation as much as we can. So there's that. Michael Sanderson of MACO gave an update about the family leave program that I talked to you about last week. There is a thought that the program will be delayed by 18 months. With contributions starting January 2027 rather than July of this year, meaning that the benefits would be a year beyond that. And there are concerns that the state would have some pushback on these bills, and some concerns that the legislative initiative is just not clear yet. So the conversation was kind of vague. However, MACO did want approval from their legislative committee to support amendments that would ensure that anyone who chooses to opt out would not be required to hold the funds in escrow, especially in light of all the fiscal issues. The concern is there'll just be money sitting there that people would need for other resources at that time or not want to spend it. So the hope is that once there's clarity on the bill, whether it's a part of the BRFA or its own piece of legislation, that they can start as MACO and individual counties to advocate on these amendments to make sure that money isn't just sitting in escrow and anything else that could potentially arise. So I'll keep you posted as we learn more and as we see the actual legislation. But that was important, that at least there's a delay of 18 months on that initiative. As far as the four bills that we have going through the process, they're all where they were last week. The hunting bill is awaiting a hearing coming up early in March. The others are either awaiting their cross-file hearing or committee vote. Pretty much every other bill that I brought before you, the same, is in that status, and I will let you know specifically where each bill stands in a packet following this meeting. But I'm going to talk about just a couple of other bills that were brought up this week, just for your information. There's legislation, House Bill 1103 and Senate Bill 979, that centralizes short-term rental tax collection under the state comptroller while allowing counties to set tax rates. The goal of this is to simplify tax collection from platforms like Airbnb and VRBO. There were some concerns brought up, but essentially both bills were supported with amendments by the MACO committee with the goal to safeguard local authority and improve transparency and make sure that it would not, disrupt anything that's already going well in a particular, jurisdiction. And every jurisdiction, as you know, is a little different with how this impacts them. Another issue that came up was House Bill 1405 and Senate Bill 883. Both of these bills create a lien on certain properties. It's regarding towing, impoundment, and storage of motor vehicles removed from privately owned parking spots, and those that are subject to police initiating towing. So the impact of this bill is that towing companies would gain stronger legal backing for recovering unpaid fees, but they would have to comply with the rules. And vehicle owners would get faster and more accessible way to dispute any wrongful tows. Local governments would have to set up and manage the administrative hearing process, and parking lot owners would have to update their signage to comply with the laws. The committee at MACo's legislative committee voted to oppose both bills because of the concerns over the mandates for local government. So that was just something to bring to your attention. House Bill 1491 proposes an amendment to the Maryland Wage Payment and Collection Law to address how wage deductions for public employees are broken down. And essentially, the current law allows that employees can only make deductions from wages in certain exceptions in certain categories. And this would just add a new exception specifically for government employees to allow them to make deductions from their wages if it's related to a compensation or benefit plan. This bill doesn't really have any concerns for counties as far as MACo's concerned, and it was recommended to take no position, but because it impacts counties, I thought it was worth mentioning and bringing it to your attention as well. And then the last bill that I was going to bring up today, House Bill 885, Senate Bill 625, is focused on police accountability, ensuring that certain records of unfounded or exonerated misconduct complaints are removed from police officers' personnel files after 3 years, provided that the outcome of the investigation was favorable to the officer. So this would just impact local governments in the way that they would have to potentially revise their personnel record systems to accommodate removing these records if necessary. And some of the committee members supported the bill because they thought it was good for fairness and accountability. Other people, weren't quite sure where they stood or had no position on this. So the impact is uncertain, and it could have a slightly positive impact. I have to look up where MACo took a position because I didn't note that here. I think it was no position if I recall, but I will make sure to let you know where MACo stood on that one because I can't remember off the top of my head, and I apologize for that. But what's coming ahead next week, there are going to be energy bills heard next Friday in a joint hearing. And this is something, if you're interested in going to Annapolis and weighing in, let me know, and I'll help make sure you get talking points and get signed up. We definitely are going to have a lot of different people from different local governments and the counties in MACo there. And the goal that MACo is trying to help facilitate is just different talking points for everyone that comes so that it's not just echoing each other, and making sure that they're, giving some new, unique perspectives based on who's presenting those, the testimony. So I can help with that if that's something you're interested in. At this point of session, it's really going to be a very few bills, if any, trickling in that are of new topic, but you'll be hearing from me about where things stand, where they're moving, how you can help, where I think it might be important for us to, weigh in on different things that have already been put into the process. A lot of the bills are going to start getting voted on in the Senate or the House and then crossing over in the next couple of weeks. So we're in that kind of time where things are going to start moving. So I'll keep you posted and just keep in touch with me. I will follow up so you have in writing everything I talked about today, as well as some updates on where the bills from the last couple of weeks stand. And I'll make sure that I also include a copy of the 4 letters that I've emailed you as well in that packet so that you can take a look at those. And if everyone could get back to me on those, I'd appreciate it. And if there's any other issues that you want to weigh in on, let me know, and I'm happy to draft letters and circulate them, amongst the commissioners to make sure that your voices are heard in Annapolis. Any questions?
Do you want to talk about gaming with us?
So Pam, sorry. So the 28th, I am interested in being down there.
Okay.
Yeah, that's huge. And a lot of work's being done on the energy issues. iGaming. I reached out to the delegation to ensure I was in the same, sheet of music. They are absolutely against this legislation for iGaming, as is many of the counties, surrounding counties. So it was asked if we would want to do a letter and co-sign a letter, to go to the, what's his name, Ferguson, the president, Ferguson, objecting to the iGaming legislation. I have a template I can provide. I think it doesn't have to be all 5 of us. It could be. If not, it could just be, President Kyler. Regardless, whichever works. But I think it's an important topic. Unless, and I apologize, I'm looking at you. I should be looking this way. Is anybody for iGaming?
Well, just very briefly, what is it about? I mean, the bill,
It's the, you see all the commercials about, betting and all that kind of stuff. And I think there's only 7 states right now in the United States that allows this. It's just going to add to, more problems with gambling and gambling addiction, that kind of stuff. So you could imagine all the casinos here in Maryland are absolutely against it because it takes away their business. But that's one side. But then I reached a delegation; they're absolutely against it because, again, it's just not a good thing. So
is it just like a perception on the part of some in Annapolis that this is another way to generate revenue?
Yeah, the intent would be to generate revenue for education. That's where the revenue, they say, will go.
I've heard that song before.
That's right. That's my whole point. Is there's a track record of, man, I'm getting so close to being Jersey. There's a track record of them not coming through with their word, and I don't want to give it again to them. Them being Annapolis. So if you're all for it, I will provide it to Pam.
I'm in.
Sure. Okay. The continuing resolution goes through March 14th of this year, and it's that at that point they'll probably determine whether we go into special session down in Annapolis. And everybody's wagering on what's that going to look like, and nobody knows at this point. The blueprint, as I've shared with many of you, and somebody's got to convince the speaker that she's wrong, and our delegates are trying to do that. I don't know who has that. Ability. I don't know if it's our governor. I don't know if it's the Senate president. I don't think it is. But it's just a freaking mess. And, it's a $20 or $30 billion price tag with no funding coming our way to spend this. And we are in a world of hurt. So I'm looking at you, but I'm also looking into the community. We got to do something because we are no longer reaching the cliff. We're on the cliff. And, there is legislation from Mameco's perspective. We're trying to piecemeal some legislation that will specifically take away some of these financial fiduciary requirements. But there's that big, herd of elephants of blueprint that we've got to deal with. So, yeah, Pam, if I can ask, just continue to keep abreast of any moving pieces dealing with that. Then just let you know from, again, and I appreciate staying on board with the PSC, everything that, dealing with the PSC, we are working with the legislation that it is always going to be in our favor and not the PSC. And really what we're looking at is local control and not PSC trying to do end arounds. No, but I appreciate it. You captured most of it, so thanks.
No, thank you.
I had one.
And I'll talk to you about some ideas about the blueprint.
Okay.
Like discussion too. I have a few ideas.
Okay.
Yeah, love to hear those. I have just one issue. I don't know if you're already tracking House Bill 97, cross-filed to Senate Bill 409. It's the Economic Development County or Municipal Corporation Economic Development Authority powers and use of proceeds. I haven't had a chance to dig into it. It appears at surface it's just very innocuous, but I think the devil might be in the details. And I just want to ensure on a county level that we don't have anybody ever from the county going down to Annapolis and attending a hearing on behalf of a bill without speaking with us first. So if that's not the case, I think we're probably okay. But I'm always a little nervous about a bill that just talks about, you know, changing names and authorities, but then gets into some language that looks like it may establish a more statewide level of authority in terms of economic development. That's the last thing we need. That's why we have an economic development department here in the county. They do a great job. But this is not a bill I don't think any of us were tracking. Just the general concern, as always with any bill, you know, that we don't have people going from the county. I don't think that's the case. It's happened before with some of our partners, but we don't have anybody from the county going down there without first talking to us, obviously, if this is something we support. So I don't think it's the most important bill on your radar, but just kind of a little curious to see where this goes, because again, I think the devil's in the details on some of that, and that's all for me.
Is this the one that was put
That
in
one
by
is on my list.
Frederick?
I'll pull it up and get you an update so that I can tell you specifically where things are and the information I have on it. I'll just tell you, and this is not official, but from, you know, just joining the county recently and meeting with a lot of the departments, one of the questions I asked most of the department heads or team members that dealt with any part of legislation was, you know, do you ever go to Annapolis? And for the most part, they all pretty much said very, very rarely. And I think they're all aware of, and I'm not speaking just from our informal conversation, of the need to come before you before they would do such a thing. And I know that anything I'm speaking about, you're aware of if I'm weighing in on it in any way. So, you know, Roberta may have more to add to the official way that this runs, but just from my perspective, I'm only talking about things that you're aware of and weighing in on legislation on your behalf that you've agreed to.
I think you're talking about the Decade Act. Is that?
I
don't know what you
I
said.
pulled up the bill number.
Yeah, I don't
What's that?
think I don't think so,
Oh,
Commissioner.
because
I
the
don't-
Decade Act was something that the governor announced. These are his priorities with economic growth here in Maryland, and that legislation went through, and we, as Mako, you know, said yes. You know, it had to do with like cybersecurity, quantum physics, and something else. I don't know if that's it.
I think this is a bill that Frederick put in last time, and they're doing
okay.
it again.
Okay.
I don't know why they're not doing it as a local authority
Yeah,
bill,
okay.
personally, but it's
this
if it's
isn't
the one I'm
Decade.
thinking of, it's
not
they,
Decade?
They want an industrial development authority similar to what we already have. Carroll County already has, and they're. Is that the one, Pam?
Yeah, I just pulled it up. It expands the definition of authority in economic development article to include a revenue authority, a redevelopment authority, or other similarly named authorities, and expands the powers of an authority. It provides that an authority may receive money from any public, private, or nonprofit source to fund the authority's activities, powers, and duties in accordance with statute. It authorizes authority to issue bonds in accordance with an ordinance adopted by the governing body that created the authority, and expands eligible uses of tax increment financing and bond proceeds. I'm trying to see if it references each jurisdiction.
No, but it sounds like it's enabling. It sounds like it's giving counties the ability to do something. So if Frederick, that makes sense. They want,
Yeah.
we do it well. Other counties want to have that authority. So that's what that sounds
And
like.
it does sound that way. It just, the more I read into it, I just wanted to make sure there weren't any trapdoors in there, because we certainly don't need, I don't feel like we need to change sort of how we're operating, but no, I appreciate it. I know you've got our back with these issues and legislation and people heading down there, Pam, so thank you.
Yeah, no, it's always good to check because you never know what can be missed, easy to miss.
Yeah, no, please always ask. There's so many bills and there's so many that are similar to each other. It's always important because sometimes that's what happens. You'll see 2 or 3 bills that almost look identical, and it's that one little detail that makes the difference. Okay. Well, then expect an email from me later today, early tomorrow, and please get back to me about the package of bills that I've emailed you a couple of days ago, and I will be available for whatever else I can help you with.
Thank you very much, Pam.
Thank you.
Thank you.
Thank you. Have a good day.
Okay, our next item is presentation of the actuarial study results for the requested enhancements to the Carroll County Public Safety Pension Plan.
Do you have
And,
two comment cards?
yeah,
Oh.
It's loaded, right?
would you guys rather do a presentation and then hear public comment, or are you ready to hear it now?
That's your decision. I mean, there's a presentation with information that may be relevant to the comments.
Yeah, I think so, so. you
Y'all are
first.
sitting so close together, you could spread out, you know. Got plenty of chairs, but.
All right. So Warner's the driver today. As many of you may know, Warner is leaving Carroll County government. He will be here until March 12th.
Who authorized that?
Why is that? What?
No, who authorized that?
Who authorized that? Well, I didn't, but he is here to answer any of your difficult questions before he goes. So
Stay.
that's why he's. That's why he's along. No, and I want to introduce you to Carrie Mayat. She is the person that will be filling Warner's role. I'm not going to say his shoes because those are some big ones to fill, and it'll take both of us a good long while to learn everything that he's done for the county, and we do appreciate that and want to thank him for his service. So wish him well. I think he's going to be on a beach somewhere, so at least that's what I believe.
And he's not taking us, so.
Yeah, right. So that's the disappointing part. So if you'll please welcome Carrie into Carroll County government. We are very lucky to have her and looking forward to having her as part of our team. So our purpose here this morning is to provide you with information that you requested when you asked us to do a study with our actuary on the public safety pension plan enhancements that were requested. I believe the request came in sometime either early last year or even at the end of 2023. So we do have the results of that. We're going to go through a summary of them, and then we'll be happy to answer any questions that you have either along the way or certainly at the end. So if we want to turn to the first slide, this is just a summary of the requested changes that came through to you. You may recall there was a request, and again, some of these are current benefits. So vesting after 15 years of service, that is already a current benefit. 25-year full benefits, also the current benefit. Full retirement benefit equivalent to 75%. That was a request that we'll go over today. Disability benefit equivalent to 66 2/3 or 0.6%. Also a benefit request that we'll go over. Institution of a 5-year deferred retirement option plan, so a DROP program, which we will also go over. The yearly cost of living increase to retired members equivalent to 2%, somewhat of a current benefit. Right now, the current benefit is based on the CPI index, so it's no more than 2% in a year. And just a little side bit of information, in the past years since 2010, there has been the 2% CPI increase in all the years except 7 years. So in the past 15 years, the CPI increase on the pension has been 2% all but 7 years. And then lastly, the grandfathering of all existing members into the system. Obviously we have individuals that are already retired in the program, so to institute benefits to them that were any changes that are made for employees going forward is an additional cost to the plan. What we looked at was not grandfathering and looking at the plan changes going forward. Okay. And we'll move on to the next slide. So some of the overall study assumptions. This information is specific to the public safety pension plan, which includes law enforcement, corrections, and our uniformed staff of fire and EMS. The information that will be presented is based on a point in time. So the current actual data from law enforcement and corrections as of July 1st, 2024 is the point in time. The current actual data from fire and EMS employees as of that date, July 1st, 2024, and then projected staffing of fire and EMS through fiscal year 2025. So we worked with that total number of fire and EMS positions of 220. Our actuary, Boomershine, has reminded us that any changes in pay rates, hiring, turnover, all of those have already changed the numbers. So as I said, this was as of a point in time, July 1st, 2024. So the next day already, some of that information could have changed based on whether we had somebody leave, somebody new come, if there were any pay changes or anything like that. So I just ask you to keep that in mind as we go through this. And any adjustment in the number of, I'm sorry, I just already said that. Any adjustment in number of positions or pay increases will also affect the numbers. So the purpose of the study was to determine the required employer contributions needed. So we're going to go through those specifically for each requested enhancement to the plan. And we'll first start with the change in the benefit formula. So a lot of numbers on this page. First, at the top of the slide is the current benefit. So this is the current public safety benefit. So you'll see, based on years of credible service, what the multiplier on the pension is. And then we asked for cost estimates based on the three different options. So the first was a 2.3% multiplier, the second 2.4%, and the third 2.5%. So going down into the table of information that was presented from Boomershine, you'll see our actuarial accrued liability. So that is the present value of future benefits. So those are the benefits that are already earned by the individuals in the plan. And then you'll see our plan assets, which are currently at near 50 million. And lastly, our unfunded actuarial accrued liability. So that is simply the AAL minus the plan assets, and we get to our unfunded, our unfunded AAL. The funding ratio is just taking the plan assets and dividing by the AAL to see how the plan is funded. You'll see those numbers there. I just encourage you to remember underfunding and unfunded are two different things. So just make sure to keep those two things in your mind. We do have an unfunded liability, but that does not mean that it is underfunded. And lastly, the additional county funding needed. So with our current multiplier, which are those numbers at the top there, if we would adjust that, with our current multiplier, the county cost is about 4.9 million. So that is our contribution to the plan as determined by the actuary so that we can provide those future benefits. If we adjust that to 2.3, 2.4, or 2.5%, you'll see the additional county funding needed increases. So as an example, for the 2.3%, if we would increase from current to 2.3%, it would be an additional $486,000. So our cost would go from the 4.9 million to 5.4 million. Any questions on any of that initially before we'd move on? Okay. At the bottom of that last slide, you'll see there's a percent of payroll. That is looking at current individuals in the program. The next slide that you see, example calculation of costs for additional participants. These are general examples. So if we have an individual who we hire in law enforcement or the Department of Fire and EMS at a salary of $55,000, the cost for our current plan benefits is about $8,000 a year. So approximately 14.5% of the individual's salary would be contributed to our current pension costs. And that is just the pension. That's not any other benefits, not health care, not any of the other benefits that we provide to employees. And you can see how that increases with the additional with the increase in the multiplier. These are all listed on an 8% contribution. So obviously, a higher contribution would equal a lower cost, but the current contribution for employees into the public safety pension plan is 8% of their pay. And that is their base pay, not including any overtime. Okay. That was the information on the multiplier benefit change. We'll move on to the disability benefit change. Current benefit is 45% catastrophic, 35% non-catastrophic. So just to give a little definition of what that means, a non-catastrophic line of duty disability is if you sustain an injury or illness that prevents you from engaging in the usual and customary duties of your position. A catastrophic line of duty disability is if you sustain any of the following: a loss of hand, foot, sight, hearing, or speech, permanent I'm not going to say that word right, quadriplegia, paraplegia, and hemiplegia. I don't even know what some of those are. Or any other medically determined physical or mental impairment that results in the determination of your eligibility for Social Security disability benefits and prevents you from performing your duties. So there's a couple options here as well on the cost estimates. First estimate is increase to 50% catastrophic, 40% non-catastrophic. Second one is 60% catastrophic, 50% non-catastrophic. And then the third one is 66 2/3 for both catastrophic and non-catastrophic. Same calculations as were on the multiplier. These are separate from the multiplier. This is what we asked the consultant to do for us, to keep them separate so they're not all rolled into one cost, and you can look at them individually. As you can see, moving across the right of the table, as the benefit increases, there is obviously an additional cost to the county as far as the contribution that would be required into the pension plan. Questions on that one? Okay. Next page stays on the disability benefit, and just some considerations for you. First off, the current disability benefit, which became effective in January of 2022, as I just mentioned, is 45% catastrophic.
January of 2020.
I'm sorry, January of 2020. 45% catastrophic, 35% non-catastrophic. Prior to that, which was from the institution of the plan in 2009 until January of 2020, it was 30% catastrophic and 0% non-catastrophic. So there was a change made about 5 years ago. Broadening disability benefits may impact employee behavior. Again, this is a consideration. It's not a guarantee. There's a potential for additional claimants if we increase the disability benefit. The benefit multiplier would, depending on if you select one of the options, B or C, would be higher than the normal retirement multiplier. So for example, the 66 2/3 multiplier is higher than our current multiplier, which is 50.5%. So there would be a higher benefit to individuals who are approved for a disability retirement than what they would receive under normal retirement options. Vesting is not required if you are eligible for disability benefits. So right now there is a 15-year vesting time period on the public safety pension plan. For a disability, you could get that immediately. It's a couple years into employment. You don't have to be here for those 15 years. Regarding medical treatment and a return to work with a higher disability benefit that would receive a higher pension, potentially there's no incentive to continue through with medical treatment or return to work here at Carroll County Government. And lastly, in 2020, there was an earned income offset that was removed from the plan. So prior to that, there was a limit on how much earnings you could make outside of your pension. In order to offset what you were receiving, that limit was removed in 2020 when the changes were made. Last thing I'll say about that is obviously with the implementation of fire and EMS, the risk increases. We not only have our corrections and our law enforcement, but now also have fire and EMS So the pool of potential risk does increase, so that's another consideration. Any questions on the disability option information? Okay. So we will move on to the Deferred Retirement Option Program. I'm not sure if you're familiar with DROP programs or not. Just a few short details about what they are. They are voluntary programs. Eligible employees retire, but they do continue to work. You can put different timeframes on DROP programs. So the timeframe that the individual has to continue to work can be 3 years, it can be 5 years. Those are two of the most common that I've seen out there. While that individual is working, continue to work, monthly pension payments are deposited into a separate account for them, and they earn a tax-deferred interest for that account. When the drop period ends, the employee must separate from employment, and they receive a lump sum accumulated balance that's in their drop account, and then carry on with getting their regular pension monthly, just as if they had retired, however many years prior. Okay. So this one was a little more difficult to estimate because we actually don't know what type of participation we would get in a drop program. So the actuary looked at either a 30% participation or a 60% participation. The assumptions were a 5-year drop for future retirees, no cost of living adjustments during the drop period, which is one of the plan provisions you can put in place, and also that any employee who is in the drop program would be required to continue to contribute to the pension plan. So you'll see the additional costs there. If it was instituted, again, this one is a moving target, one that we're not really, they're all moving targets, but this one especially is one where, we can say these are our estimates, but it does depend on a lot of factors. It depends on what the drop program parameters are, so that will make a big difference here. Any questions on that? All right. So a couple options that we asked Boomershine to calculate to see if there were any options with regards to the employee contribution. As I mentioned earlier, the public safety plan requires an 8% contribution from base pay. We asked Boomershine to give us some other options that may offset the cost to the county. Obviously, again, if employees are contributing more, taxpayers are contributing less, so this does offset the cost to the plan. The first option that we have here is in regards to the benefit multiplier. So you'll again see our current multiplier and those 3 options that we gave. Top square of the table is exactly what you saw on slide 3, I believe. And then it works through if the employee would contribute 9%, what the county cost would be. So you'll see that in that second yellow line there. There is a slight reduction in the cost to the county with a 9% employee contribution. And then the third yellow row there is if the employee contribution would be 10% instead of the current 8%. Any questions on that? All right, and then on the next slide, we do the same thing for the disability benefit. So you'll again see the same information you saw early on in the presentation. In the first square box there, the second yellow row is what the disability costs would be if there was a 9% employee contribution. And then the third yellow row would be what the cost would be with a 10% employee contribution. Just one thing that I'd like to point out, we recently reviewed our plan valuations with Boomershine, and that is different from this report. That is a report, again, as of a specific date. We have to do it every year. We send them the information for our current employees and current retirees so they can take a look at our plan. And what we discovered was that in the public safety plan, the employees' contributions to the plan account for about 36% of the plan costs. For the non-public safety plan, the employees' contributions cover about 48% Sorry, I was looking at the wrong thing. So 36% in the public safety plan, 48% in the non-public safety plan. So, you know, you might say, well, the public safety plan has a higher contribution amount than the non-public safety plan. Public safety is 8%, non-public safety is 5%. However, because of the lucrative benefits that the public safety plan receives, which are different from the non-public safety plan, their percentage to cover the costs of the plan is lower than the non-public safety plan. That was a lot of words for a few things. All right, so I believe the last slide I have is the total costs of the requested changes. So this is just kind of taking a few of the options and adding them together. We took the 2.4% multiplier, and that's your first yellow row there at 8% contribution from the employees. We then added to it the request and disability benefit increase to the 66 2/3. That's your second row of yellow. And then with the assumption of a 30% participation rate in the drop plan, we added that cost, which is the 1.7 million in the third row of yellow. So the additional county funding for those three options would be the $2,027,000. And we can do all different scenarios of, you know, 2.5% multiplier and 50/40, you know, all those different options. But these were the ones that more closely related to the actual request from the individuals in the public safety plan.
So this was their request?
There was a letter that the commissioners received from then FOP President Brandon Holland. I think one of the requests that they made was actually an even higher multiplier. They had requested, I believe, 3%. We did not go that high. We went up to 2.5. And then we did the 66 2/3, which was one of their requests, and also implementation of a drop program.
Is this number currently in our operational budget for FY '26 or not?
I'm gonna let Ted talk to that if he's
I
here.
figure he would.
Yeah.
And he may not have heard the question because I was asking him about something else that
You
we'll
were-
talk about later.
I'm asking if this is in the projected budget or forecasted budget for FY '26.
Depending on what choice you might make.
That 2,027,000.
Right. You've added, you did add $2 million a year in anticipation of doing something.
Yeah.
So to the extent that you do 2 million or something less, you're covered. If you go beyond 2 million, then we would need to add something more.
Okay, yeah.
Just one thing I'll point out, when we did the valuation back as of June 30th, 2024, there were 318 active employees in the public safety plan. Right now, that's going to be approximately 372 based on the hiring that we've done. That was the actual employees as of June 30th. We were at that 318. So all of the additional employees that we added between then and now, we're at 372. And as you're aware, we do still have some hiring to do for the Department of Fire and EMS, for the stations that are yet to open, and to fill some of the back vacancies that we have from people that have left us.
Do you feel like you're being watched? Go ahead, Ted.
Ted's back. Oh, sorry, Ted. Sorry, I'm sorry.
No, Christine made me think about something. So remember at the beginning of her presentation, she made the point that all these calculations are a point in time that is already in our past. So we don't know exactly how much this will cost. So when I say you're covered up to 2 million, if you added benefits that are exactly $2 million as of this report, then we probably are underfunded by something. But I don't know how to tell you what that would be. But it's not going to go from 2 million to 4 million, but it'll be something different.
Okay.
Guess we've got some speakers.
Public comment?
Public comment?
Ash Owens. Can you drop so that we can see the 3-minute clock? Yeah,
I think just escape.
yeah, then close it.
Go back to the, where is it?
Just close this. Just close this. Yeah.
Okay.
Thank you.
Good morning, Commissioners. My name is Ash Owens. I'm the president of the Carroll County Fraternal Order of Police. I'm also a detective with the Carroll County Sheriff's Office. Sometimes I like to put the uniform back on just to make sure it fits. But thank you for requesting the study. You started this process in 2023 with a similar study that you all were able to get some information on, and I think you're building off of that. You put $2 million into the cause. Something can happen to anybody at any given time, and you can't plan for that. And it's tragically unfair when that happens, and somebody isn't able to continue the job that they wanted to do for their life, the job that they love, and may not even be able to continue to work. And that's if they thankfully survive whatever tragic circumstances struck. So I thank you all for recognizing that was our priority and appreciating that and putting that money into place and looking at, and I know from what Mr. Zaleski was saying and what Christy had mentioned too, that it was a point in time. What we're looking at aren't hard numbers that are going to be able to be applicable to right now, but I think that they're still close enough to give you guys an idea of what we're looking at with the $2 million that you already put in. I believe that from what I'm looking at, and I'm not a math expert, in fact, I did terrible in math in school, but from what I'm seeing, it looks like the $2 million is more than what's really needed for the disability portion, and I think that you all have the ability to take a closer look at this. Christy did a fantastic job with putting this together for you guys to have an understanding of something that's very complex, so I commend her for that. But it gives you the ability to look at it, dig deeper, especially when you start going into the budget session here and whenever you all obviously want to decide to do that. But I think you can dig deeper and look at it and say, okay, what we put in covers the disability, which was the first priority that we had. The leftover, it looks like, can do some of the other things like the drop. It can do the multiplier for the retirement. So I think that it's very doable, and keep in mind that with the process from the last time in 2023, we communicated to you guys that we, as an organization, I won't speak for Mike and the fire and EMS, I'll let him speak for that, but we are very willing to increase our employee contributions to offset some of this. It's especially when it comes to the retirement and the disability. I think it's important for us to be willing to work with you all to reduce the taxpayers' contribution into this, because it's something that I think is important for public safety. It's important for our program. It's important for recruitment and retention. I think if we can get this done the way that it's kind of been laid out, that it's going to go a long way with our organizations and being able to get the best people in, keep them here, and be able to serve public safety in Carroll County. Thank you.
And the only other one is Michael Karolinko.
Surprise. So I had a beautiful thing written out. First off, Michael Karolinko, president of the Carroll County Professional Firefighters and Paramedics Association, proud First District resident and taxpayer of Carroll County. So with that out of the way, I had this beautiful monologue that was Joe Vigliotti-esque that I was going to read, but that got blown out of the water. So I just want to put out, I would absolutely reiterate everything that Ash said. These are necessary changes to increase our postures, not only being competitive, increasing recruitment and retention, increasing organizational health and all those things. However, I think that there's a very real sense that we have to look at the personal level, and I understand that there's differences in contributions and everything like that, but I'm not sure of any other kind of job line that when you get into the course of our daily job, the term immediately dangerous to life and health is an expectation. It's something we walk into on purpose because we're responding to that situation. We do approach this conversation different because it is a different conversation. And I think we need to continue that, that kind of orientation on how we handle this. One of one of the things that was called for by Brandon from pretty much the beginning, and then continued in when I was August 10th of 23. There you go. Was the last time this was presented, and one of the conversations was a work group to be able to really address these issues. One of the core pieces that we're looking at here is employee contribution. There's so many dynamic factors, and one of the things that Mr. Zaleski said in that meeting repeatedly was how complex this issue was, is that it was far too complex to truly dig into in this kind of forum and needed additional work. So what I'm going to continue to call for is a collaborative work group to bring us together to further flesh out these options, the different facets of the plans, and then also, you know, the employee contribution side, being able to bring it to a achievable, sustainable level with the county. Because if we take a posture that isn't one achievable or sustainable, we're done in the end anyways. And I don't think anybody wants to see that. Last thing I'll further is through our association, I think the county is absolutely doing everything they can to be prepared for this conversation. We heard from over and over again, let's hear from the subject matter experts. Our association, through the International Association of Firefighters, has a branch called the Financial Corporation. It's a massive organization that specializes in this. They don't do pensions for other people. They don't do other services for other lines of work. They do it for this exactly. They're internationally recognized subject matter expertise in this matter, and we have access to that to bring it here. So even the chief operating officer of the IFFFC was planning on being here today up from D.C., Mr. Alan Westcott. He wasn't able to attend because of the snowstorm down there, but you know, we really appreciate them mobilizing all of these resources. We're just asking them to bring them to the table to help develop this situation at the awesome cost of free to you. And then I know my time's up. I just want to say, like, one last point of personal privilege, I guess, towards Mr. Mueller. Us coming on board, we obviously had a lot of concerns of learning a new system and learning what the impacts are going to be on us and everything else. Mr. Mueller has been available to every single one of our members in a real way the whole time through. One of the first things that we did kind of looking at this is I sent 10 questions that I barely understood to Mr. Mueller about our 357 and our 401k plans to try to get a handle on some of the understanding there. And the experts from the international level, from the IFFFC, turned around and said, in those two cases specifically, this is the way business should be done. And I think that that's a absolute point to him, and I appreciate the personal point of privilege. But sir, thank you for everything you've done for us, and good luck in the future.
Thank you. Thank you. That's it? I was worried that he took the next person's time,
I think
so
he took
we're
the next three
okay.
people's time. It's his MO. Anything else for us on this?
Any questions, comments, commissioners?
So I guess maybe on that last point about a work group or gathering more information, I mean, is there a process to be able to do that, to gather more information? Because I think it's certainly commendable that anybody who might benefit from this is saying that they're willing to contribute to it. So, I mean, is there...
we can talk about what the options are.
Yeah, we could talk about it.
Okay.
Yeah, I think we need to decide what we want to do. And then I'm sure we'll hear comments.
Yeah, I do like the idea of a work group. If and I know that you two gentlemen, you speak for your members. That's why you're elected. I do like the idea of a work group, if only so when we go forward, we can, in a very tangible way, make sure we understand where each of you fall with what's been recommended. It sounds to me like we're in the right spot and we're in the right place. I mean, if there are some options, it might be nice to know. If there's some other asks, it might be nice to know. I mean, my concern going forward is going to be that, we can always add to these benefits, but we do not, and we talked about this a little bit earlier, we do not want to put the county in a position where you would ever have to look at benefits and say we have to reduce them. That would just be completely unacceptable. So if this is a good starting point, that's great to hear. If there's a way we can sort of, again, in a tangible way, just make sure we understand where both of your organizations sit, and that would be probably helpful. But as Commissioner Kyler mentioned, ultimately it is up to us.
And I would agree with your comments, Commissioner Guerin. I think, we talked about this the other summer, and I had mentioned at the time I'm not I'm actually in support of us maybe having that work group, because I think, more information is better, but to your point, it does come down to us at the end of the day.
Thank you.
Yep.
Thank you.
Very much. Thank you, everybody.
Now, spending authority for inmate medical services at detention center.
Good morning to both of you.
Good morning.
Morning.
The Office of Procurement, in cooperation with the Carroll County Sheriff's Office, requests your approval to spend up to but not to exceed $509,400 for on-site medical services for individuals incarcerated in Carroll County Detention Center for the remainder of fiscal year 25 to Prime Care Medical, Inc. The county currently piggybacks the contract for Prime Care Medical, Inc. utilizing Cecil County's RFP 21-04 that was competitively bid. The funds are approved in the fiscal year 25 budget.
Good morning, Commissioners. This is just our request to encumber the funds for the rest of FY25 as was explained for these services.
It's a continuation of service, correct?
Correct.
I thought maybe we were going to make a motion, sorry. I'll make a motion to approve the spending authority for on-site medical services for Carroll County Detention Center inmates to Prime Care Medical Incorporated in the amount of $509,400.
Second.
I have a motion and a second. Any further discussion or questions? All those in favor? Aye. Opposed? Thank you. Now, food service operations at the detention center.
The Office of Procurement, in cooperation with the Carroll County Sheriff's Office, requests your approval to spend up to but not to exceed $277,100 for food service operations for the Carroll County Detention Center inmates. The amount will cover costs for the remainder of fiscal year 25. The county currently piggybacks a contract for these services utilizing Calvert County's contract 2020-033 that was competitively bid. The funds are approved in the fiscal year 25 budget.
The food services are not causing the medical services, correct? Just want to make sure.
So, similar situation, Commissioners. This is a continuation of services looking to encumber the funds for the rest of the fiscal year.
Motion to approve the spending authority for food service operations of the Carroll County Detention Center inmates in the amount of $277,100.
Second.
I have a motion and a second. Further discussion or questions? All those in favor?
Aye.
Opposed?
Thank you.
Thank you.
Caught you off
Know
guard
about
on
now.
that one.
The cookies used to be really good.
Approval to award a contract for systemic renovations fire alarm system at the community college.
Good morning to you both.
Morning. All right. The Office of Procurement, in cooperation with the Bureau of Building Construction, solicited an RFP for the removal and replacement of a fire alarm system at Carroll Community College. The request for proposals requested technical and financial proposal submissions. The county received 2 proposals, and after evaluating both technical and financial criteria, the evaluation committee recommended the award to Nichols Contracting of Columbia, Maryland, in the amount of $4,547,000. This purchase will be made with 52.1% that will be covered by the Maryland Higher Education Commission grant, and 47.9% will be covered by county funds.
So this is, excuse me, this is a project at the college. We'll be replacing the fire alarm system in its entirety in all the buildings. A majority of the buildings, the fire alarm system is well beyond its useful life, and facilities has had a hard time getting replacement parts. So this will integrate all 8 buildings together. And construction is planned to work from June 2025 through December of 2026. So we're waiting till June because of lead times for equipment, and because they are all occupied buildings with only short times when students and faculty aren't around. It will take a little bit longer than a typical fire alarm replacement, but we are very confident in Nichols.
So the 2.178 that is being requested, these are county funds that are already within FY25 budget, or these would be in addition to what's in FY25 budget?
They are approved.
They are approved? Okay.
Yes.
I'll make a motion to award a contract to Nichols Contracting for the removal and replacement of the fire alarm system at Carroll Community College in the amount of $4,547,000.
Second.
I have a motion and a second. Any further questions or discussion? All those in favor?
Aye.
Opposed? Thank you.
Thank you.
Thank you.
Development allowances for residential development.
We do have a public comment for this one. Do you want to do that first? Or,
Hey, Kenny, we have a public comment. Do you want
we have a
again?
public comment for this one, sorry.
There is one for this.
Do you want to do that first?
You want to do the presentation first?
Oh, I think the presentation will provide some context then for discussion, so that would be my recommendation.
Okay.
All right. Well, good morning, everybody.
Morning. Morning.
So, yes, we're here to, yeah, still morning. So, we've termed this concept development allowances, and just as some background to bring you up to speed with what we're talking about. So, back in the 90s, we were in a period of pretty significant residential development, and it's certainly different than what we have today. The then Board of County Commissioners established some tools, as it were, in the toolbox to help moderate that explosive development and to allow for some balance in how development proceeded in the county. Certainly, we're in a different climate today. And actually, the pendulum has kind of swung to the opposite end of the spectrum in that it's recognized in both nationally at the state and here locally that we do have some challenges with housing, especially housing that's affordable for the average person. So on October 10th, you all directed us to work with the Planning and Zoning Commission to look at some of the codes that are in place and to determine if maybe some changes to those codes were appropriate. So we held meetings with the Planning and Zoning Commission, 3 meetings in November, December, and January. And we're coming back today to talk about what those recommendations were from the Planning and Zoning Commission and to see if you'd like to proceed with anything along those lines. Before we get into that, though, I did want to provide a little bit of background on something that's happening in parallel that may influence the discussion just a little bit. So currently in the state legislature is Senate Bill 430, which is called the Housing for Jobs Act. It's interesting legislation. I don't know that how much it's going to really affect us. What the legislation is doing is drawing a correlation between jobs and the amount of houses that are needed for the people that use those, that have those jobs. And what the bill has identified is that there's a deficit of close to 90,000 housing units in the Baltimore region. I've been very curious to find what the impetus is for this bill, and what I've been told informally is that it's basically that there's a perception that local jurisdictions, such as counties, are impeding residential development. I don't feel that that's correct, certainly in our county, and I'd love to see the use case of where that is occurring. But regardless, that's the perception that's out there. And so what this bill does is it essentially prohibits, if it's passed, would prohibit local jurisdictions from denying residential development for subjective type of reasons. We just don't like the developer. We don't like the look and feel of it, but they meet all of the regulations, those sorts of things. It does not touch anything related to our normal authorities related to health and safety, school capacity, water sewer capacity, and it doesn't apply to industrial zoned areas and so on. So I don't believe that it will affect us that much. However, the codes that we're talking about could arguably have an impact if we left them in place. So, for instance, we're talking about limiting the number of building permits that a developer can receive every year. That could be viewed as sort of an arbitrary code and could be challenged if the state law is put in place. But I don't think this is an issue because I believe that everybody is on board with the concept of looking at these and making some adjustments. So, but just wanted to provide that backdrop that at a state level there's this consideration.
I believe the catalyst was more Baltimore City, trying to build more homes for the workforce. And opponents of this are like Montgomery County, is defining what are homes, you know. Are we talking about single-family homes, townhomes, condominiums, multifamily homes? And, yeah, I think they were not happy with this type of bill. And you're right, I don't think it affects us that much, so.
Yes. Okay, so in our discussion, I did want to. This is a complex process, and I did want to lay this out with some clarity. So what we're talking about is the subdivision process, right? And there are generally 3 phases that a developer goes through when they're trying to subdivide and build out a residential subdivision. Phase 1 is the what I term the engineering side. So that's designing, getting the permits, the environmental permits, and getting doing the engineering design to make sure that everything that they're proposing can be built. Phase 2 then is the recordation. So that's when the lawyers get involved. And that's the legal side of, yes, this subdivision can happen and all those components. And then the third phase are the building permits. So those are the contractors. So engineering, lawyers, and then the contractors. So we'll walk through each one of those because they build on each other. So phase 1, the development. So we've included a schematic example of a subdivision that happened here in Carroll County called Pooldale. And you're starting with an undeveloped property. In this case, it was 3 parcels. And so the developer goes through that development review process that Laura's bureau manages. And that's where our technical staff ensure that all technical regulations are met and that from an engineering perspective, it can be built. And then what it's important to note is that it also includes the Planning and Zoning Commission, right? So the project goes through multiple reviews with Planning and Zoning Commission, and that it's also tested for adequate public facilities. So that stopgap of balanced development and ensuring that we don't outpace what the county resources are, those are checked and affirmed as part of this first phase with adequate public facilities. So the end product of this first phase is basically an approved subdivision plan. So you've proven from a physical perspective that what you want to build can be built and it's fully approved.
Now,
Yes, sir.
is this the only phase where it's tested for adequate facilities?
Yes, it is.
Yeah, I personally think we are delaying development. I don't know that I don't know when the last time we said fire, EMS, or roads were inadequate. We keep saying schools are. There's plenty of room in the schools. It's not the case. When this was developed, we were worried about building schools.
Yes.
Now we have too much capacity in our schools. I'd love to see that maybe be advisory instead of mandated or something. If we could do something to soften that, I don't know what everybody else thinks about it. It's
Soften the school
I don't
piece?
understand us deciding whether a school's adequate or not.
Yeah, so you're saying soften the school piece.
Well, to me, it could all, like I say, it's the money we're throwing in EMS. If they say they're inadequate, we got a problem. Roads, if a road, most cases, if a road's not adequate at the entrance of a development, we make them improve it. You know, so the schools are the worst.
Yeah.
Because I think enrollment, the least factor in whether enrollment grows or not is how many houses are built. Yeah. It's more birth rates and who's moving in and who's not moving in and all that. It just seems like we should say, we're building, and schools, you need to figure out how to educate everybody.
Yeah.
Kind of, and I don't know if we can ever force them to redistrict. It just seems like that's a four-letter word in schools, but if they have to, they have to. That shouldn't be our problem.
If I may, if we could put a pin in that for a minute, because following this, we have the next agenda item is to talk about the concurrency report.
Okay.
And that's exactly what
Okay.
we can talk about then. So if you don't mind.
Yep, no, that's great.
Basically, he just said, shut up and let me move on.
Yeah.
That was good, though.
I would never.
Yep.
So, as I said, ending phase one, you have an approved plan from an engineering perspective. And so now you move on to phase two, which is the recordation phase. That's when you get the lawyers involved. And public works agreements are put in place for public infrastructure such as roads and stormwater management, grading, and all of that. Legal easements are recorded on the property if they're necessary, and the lots are recorded. So that's where the 3 lots for Pooldale get subdivided and become 51 lots. So legally, there are 51 lots there now. And so that then brings up the first code that we're recommending looking at, which is 155.032 D10, which what this code says is that a developer shall not record, so create those legal lots, more than 25 per fiscal year, unless the Planning and Zoning Commission authorizes more. So Pooldale, as an example, I believe was processed in 2013, so over a decade ago. And it's kind of normal practice for our Planning and Zoning Commission to approve all of the lots that are being proposed. So this is not a tool that our Planning and Zoning Commission has really used for at least a decade. We have not limited any development using this line of code. So when we brought this before the Planning Commission, we talked about 3 options that we could potentially implement. One would be to just leave it as is, recognizing that the Planning and Zoning Commission really hasn't been using this. Another was to increase this from 25 to some other number, but that didn't seem really like it would do much. The Planning Commission recommended simply removing this code, that they didn't feel that it was necessary, because in that first phase, we do have the APFO tests, and that's verifying that we have adequate facilities. And then we have some other checks that we're going to talk about in a minute. So that was the recommendation from the Planning Commission, was to simply remove this section of code. So then we move on to phase 3, which is, now this is when we get the contractors involved. So the developer owns all of the parcels. They own the 51 lots in case of Pooldale, and now they've gone and pulled building permits. And one of the provisions that are in the code are that if we experience significant development again, and when this was put together, we were exceeding 6,000 building permits over a 6-year period. So we were exceeding an average of 1,000 per year. And so what the commissioners at the time put in place was a provision that allowed you, the board, that you may implement building permit caps. And I highlighted the word may. So there's no action, there's nothing that automatically happens. This simply gives you all the tool that if we are in that climate again of development, that you could implement building permit caps.
And that's in there now.
And that's currently in there, yes. Yep. And so just a little context of building permits. This is a graph of permits over the past 30 years. You can see that since 2007, thereabouts, that they've tapered off considerably. And looking at quantifying those numbers over the past 6 years, we're currently at 2,310. So we're nowhere near that 6,000 over a 6-year period. And in comparison, from 1998 to 2003, there were over 7,000 building permits. So when we discussed this with the Planning and Zoning Commission, again, similar sort of options. One was to eliminate the code. One was to change 6,000 to a different number, which doesn't really seem appropriate or needed. What their recommendation was to leave it as is. Currently, the code is not limiting anything, and all it does is it gives you all the power to put in some building permit caps if we get into that scenario in the future. And it's a may, so you wouldn't have to, but you certainly could. And what this does is it leaves the tool in the toolbox that if we are in that scenario, you don't have to spend 6 months or so creating new legislation to give yourselves the power to be able to put building permit caps in, you could implement them right away if we were in that scenario. So the Planning Commission's opinion was that this is a tool that'd be useful to keep on the shelf. It's not going to be used until there's a serious change in the development climate here in the county. And then if there is, then it's available for you all to use. So the last code section that we discussed is also in 15604, and this also relates to building permits. And there are three sections to this that I want to mention. So the first relates to building permits in subdivisions, such as the Pooldale. And there's currently, the code says that a builder can only pull 25 building permits per fiscal year. So those are for single-family residential. E2 relates to multi-unit residential site plans. So this would be like an age-restricted site plan with multiple buildings and so on. And there, the limit is 50 dwelling units per fiscal year. A couple years ago, a waiver was adopted by the board, which was specific to the multifamily and age-restricted or retirement homes, which allowed for a waiver request to be submitted to our department, so that would be submitted to myself, that limit of 50 for the multifamily could be relaxed, but it would still have a limit of 150 dwelling units over a 3-year period. So if you had 150 units you were trying to develop, and you wanted to pull more than 50 per year, you could ask for all 150, build those in the first year, but you couldn't exceed over 3 years. So a little confusing, but so those are the three provisions that are in this section of code. When we discussed it with the Planning Commission, again, first option, leave it as is, but this is where that state legislation might come into play, that if we left the code as is and a developer requested more than 25 building permits and we denied them, that may be arguable as being subjective, and they might be able to appeal that to circuit court and override us. The other option would be to completely remove the code. There would be another option would be to increase the limits from 25 to another number, and we did a little bit of investigation. The City of Westminster's number is 40, so they allow 40 per year. City of Taneytown allows 50 per year. And when we talked to the building industry, the numbers that we were hearing were that typically what they look to build is between 36 and 48 per year, which would average 3 to 4 houses per month. So, and then a final option would be to include a waiver for the single-family residential similar to the multifamily. And what the Planning Commission recommended was that we both increase the limitation and also add a waiver option. And their recommendation was to increase the limit to 50 permits per year. So the next slide shows what we're recommending as changes. On the left side is the existing code, and then on the right side is what we're proposing. So you can see in E1, the only change is to change that from 25 to 50. Under number 2, now I have this highlighted because we did not specifically discuss this with the Planning Commission. However, we thought that at a staff level, after we finished with the Planning Commission, that this was an appropriate change to recommend to you all. We didn't think this was a significant enough change and was very much in line with what the Planning Commission was recommending. So we did not go back to the Planning Commission with this recommendation, but we certainly could if you wanted us to discuss it with them further. But we recommend increasing the multi-unit residential site plans from 50 to 100. And then under the waiver section, that the waiver would be appropriate for both E1 and E2. And so a developer could make a request to increase the number. And we also recommend eliminating the provisions of that it's only for age restricted and that cumulative over 3 years requirement. Basically, if a developer comes to us with a waiver request, we should just either approve or deny the waiver request, and these additional caveats of numbers per year and so on are not really necessary. So in summary, there are 3 code changes that or 3 codes that we're talking about. The first is the 25 lot recordation, so that's the legal side of how many you can record, and the recommendation was to remove that it was not necessary. The second was when you're getting building permit caps, that if there are more than 6,000 permits over 6 years, that you as the board could put in place some caps, because that may be more than what we feel that the county can handle. We recommend that leave that as is, because it allows you to have the tool in the toolbox. And then the final one is the building permit limit. So increase 50 building permits per year in a subdivision, increase to 100 building permits per year for multifamily, and then have a waiver process that would apply to both and eliminate the age restricted for multifamily and eliminate the 3-year limit. So that's a summary of the recommendations. Today, we're here simply to present the information and certainly can have as much discussion as you would like. But then we would like to talk about next steps if you would like to move forward with this. So same options that we always have. If you want more information and more details, we could have a work session in an afternoon sometime. That would be part of open session. If you want to hear what the public has to say about this,
through the project, the less cumbersome it is for local residents who are potentially opposed to it or indifferent. The recordation, and again, I'm just making bullet points, delays potential tax basis. So when we record, we're going to be paying taxes on all 51 lots. So that really is a positive as far as revenue generation. And then it addresses the current housing supply. The current caps restrict if there is a condition where you could build more than 25. I think everybody in this room, as long as it's done responsibly and meets APFOs, it probably is the wise decision for the short-term future. So long and short, I think concurrency management and APFOs coupled with market conditions are what truly are going to cap any community as far as volume, pace, whatever you want to call it. And I think removing these is going to entice builders and developers to look at projects that they may not have looked at in the past because the time frame was just, it blew the deal up. It was just such a carry cost that it didn't make sense financially. So thank you for your time.
Thank you.
That's it.
That was it. Okay, commissioners.
I mean, for me personally, I don't believe we need a work session. I'm in agreement with that. I mean, I certainly would like a little bit of time to go over and consider it, but I'm not sure that we need a work group. Although, if the majority of my friends up here disagree, I'm happy to do a work group. So,
Commissioner Gordon, you brought this up a few times, and I agree with you that we should, relax these caps. And even if we relax them, people cannot build until they meet the APFO requirements. Because a lot of the, language and sentiment down in the Eldersburg area is we're building too fast, and it's going to overrun Freedom Elementary and other schools. But the fact is they're not building fast. They may have the property, but they're still, like you said, they're recording the property, but they're still not building fast. This won't change that.
correct.
This will just really get a commitment from the builder to build on that space. I mean, at the end of the day. So I like this. Are we talking about the municipalities and Freedom District? Or are we talking?
So this does not affect the municipalities, but it does affect the Freedom District, yes.
So it's only the Freedom District?
Well, it's countywide.
It's
yes.
countywide?
Yeah.
And
Anything outside the towns.
Yes.
if we do the public hearing, when would that be? 3 weeks? As far as time to look at it?
Yeah, it typically takes about 3 weeks because Mr. Burke needs to advertise it in the newspaper and so on. So it'd be about 3 weeks from now.
So that would give us 3 weeks, if that's good for you.
I'll make a motion. I make a motion that the Board of County Commissioners take no action at this time.
You mean not do anything today?
But not
That's my motion.
schedule a public hearing either.
I just made the motion, that's all.
Yeah.
I'm looking for a second.
All right, I'll second for discussion, for sure. But so the motion is to just not take any action today and just digest the information for the time being? Okay.
Any further discussion? All those in favor?
Aye.
Opposed?
No.
Not me. So what,
2 to 3, I think.
where were you?
I was no, so it's three.
You were no, so
yeah,
3
we're
no's.
3 no's.
Does somebody want to make a motion that we schedule a public hearing?
Yeah, I'll make a motion, we schedule a public hearing.
Second.
We have a motion and a second. Any further discussion?
So, okay, I apologize. The motion was not to take any action on this today. Did that?
Failed.
Failed, 3-2.
It did? Okay, all
Yeah,
right.
it failed 3 to 2.
And so the motion now is to schedule a public hearing regarding the proposed changes.
Which would mean we'd have the public hearing in 3 weeks and could still decide to make a decision
no,
or
yeah.
not make a decision.
Exactly.
Right. Yeah.
Further discussion, questions? All those in favor?
Aye.
Opposed?
No.
3 to 2 the other way, right?
Correct.
Okay,
Right.
just making sure. Following the
one.
baseball
No, it's
game.
4-1. It was
right?
4-1.
Oh,
Oh, 4-1.
No, I voted no to not do, because
Yeah.
I wanted to stick with the original
Oh, you
motion.
want, oh, you stuck with
Oh,
that?
you,
Okay.
you voted
okay.
no, so
I'm
3 to 2.
I'm a two-time loser
I
on
say
this.
3 to 2. Sorry.
Congratulations.
Sorry, I didn't hear you there.
That happens.
Can't win them all.
Nope.
All right.
So we're
Thank
going
you.
to schedule a
Yes.
public hearing.
Yes, we will.
So now we're on to concurrency management report.
Yes. And going to be joined by Amy Barcroft, who's one of our development review coordinators who worked
Wait, no,
very
after me.
Hey,
hard.
thanks for the comment.
Yes, thank you.
Thank you. That was actually pretty good comments.
Amy worked very hard on pulling together these numbers. Before we get into the presentation, I turn it over to Laura and Amy. I did want to talk about concurrency management just in general, Commissioner Kyler, based on your comments. And I fully understand where you're coming from with your interests in looking at and diving into our APFO and so on. My recommendation, I mean, obviously, we will do whatever the board directs, no question. My recommendation is looking at staff resources and the things that we have ongoing right now, specifically the master plan for our comp planning staff, and so they would be involved in diving into the concurrency management code, and as well as our development review staff who are constantly busy, as Laura can attest to and Amy can attest to, but we're also in the middle of implementing the new Project Docs software solution that's going to assist with the development review process and so on. We have a lot on our plates. Certainly completely agree that looking at concurrency and the APFO is something that we can do. My recommendation would be that that would be a good topic to come out of the master plan discussions. So as we have those discussions and chart the direction we want to go with the vision with the county and all of that, that is absolutely a recommendation that can come out of the master plan, that we revisit the APFO ordinance and look at all of the criteria and so on. My concern, honestly, is at this point resources, and that if you all wanted us to proceed with this, we would have to divert resources from other things or look at consultant
I don't-
support.
I
So-
don't understand that. If we make a motion to make it non-mandated but advisory, what resources does that take?
So
We've kicked this can down the road for 10 or 15 years. It's time to make a decision or say, we don't care if they get to develop. I don't understand kicking the can down the road further. I truly don't.
Yeah. So given that this is code related to land development and so on, I mean, I'll defer to Mr. Burke, but I believe that this would need to go through planning commission discussions and so on, and really open the code to look at like how it should be changed and so on, which is a lengthy process. So, I mean, again, we will proceed as the board wishes, but
Yeah, and I don't know what everybody else, maybe I'm the only one that thinks so, but it's just,
Oh, you mean having a discussion about the schools and whatnot, or? Yeah, I'm open to a discussion, sure.
I think actually Commissioner Kyler would like to give staff direction to go to the planning commission and start the process of possibly changing the
Yes.
code.
yes, whatever process we got to go through.
Yeah. More so than just a board discussion
mean-
or
Okay,
board discussion with staff, I think. I don't want to put words in your mouth, but I think that's what you want.
Yeah, yeah, I heard this for 4 years as Board of Ed, and never understood Well, I can back up to when they did this, they did it to slow down growth. That was the only reason to do it, not, we weren't worried about adequate facilities, we were worried about slowing down growth. And if you, contrary to the people in Eldersburg, if you look at all the charts and graphs you just did, we've slowed down growth. We don't need to do that anymore. There is no growth.
I don't know if, first of all, part of the Freedom District is in District 4, just a little bit. I don't know if people in that area would agree with that. I mean, we are having to add on to 2 schools. I'm not sure.
Say again?
Well, we are adding on 2 schools.
Because the school system won't redistrict.
Okay.
Yeah.
So
The school system decided that was the most cost-effective way to solve that problem.
Yeah. So if, I guess, I don't know how we even get to a motion or how we do things, but if it's to review the APFO, it sounds like it's to review or weaken the APFO or make it more flexible. Is that what the ask is? I mean, we're just to review,
Yeah, I don't understand why Carroll County ever decided they should work on how we educate children. It's Carroll County Public Schools. Let them do it. And the Carroll County Public Schools will tell you, we agree. And it's a state calculation that's cumbersome. I don't understand. Like you say, we need to add on to schools. My humble opinion, we don't. They're in portables and it's very effective. It's the best elementary school in Carroll County. But because of a state calculation and this rule, we're going to add on to the school. I think that's a very poor reason to add on to a school. That's where I'm coming from, not.
Yeah, I mean, obviously, there's a lot of issues that go into the APFO, and you just illustrated the fact. And it can get a little complicated and sometimes reason isn't part of the equation when you're talking with folks who are concerned about what's going on with their schools. I don't really know how to proceed with this. I mean, if someone's going to make a motion, I guess, to create some sort of working group or something for APFO, I just assume have more time to deal with what's in front of us. And if that's a conversation we're going to have, then it sounds like it's coming at some point.
So I agree with you. And you're not used to hearing that. Like
No.
And moving it to the Planning and Zoning Commission to then put this on their plate to come back with their recommendations, I think is the right way to go. And there's definitely concerns with the APFO. There's definite, concerns with the growth that's happening in our districts, in the Freedom Designated Growth Area, that folks, are subjected to. Could it be all alleviated through redistricting? Well, we presented that a few years back, and the Board of Education tabled it because there was a lot on their plate. Having a conversation back with the Board of Education saying, hey, are you ready to take it off the shelves and look at it? I mean, that's a conversation we can have as well, with the Board of Ed and CCPS. But what I would like to do is, the motion would be to take these, these specifics and give them back to the Planning and Zoning Commission to further, come up with their recommendations on APFO and come back and report back to us.
Does this apply to jurisdictions?
No.
Yeah, and
Just the county.
Just the county.
2/3 of our building in the last 6 years have been in jurisdictions.
Yeah.
So again, there's very, very, very little growth in the unincorporated parts of Carroll County.
It's Eldersburg. I mean, there's little areas here and there, but it's really, the Freedom District is the growth. So, in order to control that growth or to understand it best, taking this, giving it back to the Planning and Zoning Commission, let them come back to us, report back to us, for us to then have a better conversation, you know?
Sending it to the Planning and Zoning Commission, I guess, would have to also include what our guidelines are, but I just think by doing that, we're inherently opening up the whole discussion about it being made advisable or weakened. If that's the intention, then that's what I think some of my fellow colleagues just come out and say it, if that's what your intent is to do. But just to send it to the Planning and Zoning Commission, I think, with just, hey, review this.
I think that's the
I
process.
think it's obvious what we're trying to
I don't think we can avoid
accomplish.
that, and if I wasn't blunt enough, this shouldn't exist. I don't know what else to say.
And I
If I've
completely
been-
disagree,
If I've confused
obviously.
you in some way on whether I think this should be weakened, I'll dispel everybody.
Mm-hmm.
It's a worthless damn rule.
So yeah, I understand if you are advocating a weakening of APFO, the standards that we use for roads and schools and fire and EMS to determine what's a reasonable growth and not, then that's fine. Okay, that's your stance. I disagree with you, and
And maybe just schools, maybe just road, I don't, you know.
okay. And
Yeah,
again,
because again, I agree with you.
I happen to be around for when this started, and it started for a very good reason. The county had absolutely no idea what was going on with, and that's their fault. That was their mistake. I couldn't understand what was going on, but they didn't even know how many permits were out there, which I'm not sure how in the heck that happens. So I'm not trying to argue with some of my colleagues. Just let's just be honest about what we're asking the Planning and Zoning Commission to do, because people are paying attention to this issue, especially in a time when the issue with schools, I mean, let's face it, could things be more of a mess right now with our schools based on blueprints? So I just want to make sure we're being clear to the staff. I think it's only fair to them, what we're asking them to do, and that we're transparent with the public.
The 2035 master plan, just like any other master plan, is designed to look at the things and decisions that we made in the past, and are we going on the right path? And that's what this would do, is by giving this back to Planning and Zoning Commission, it would then say, yes, we are going on the right path with these tools. I'm not, going nearly as far as Commissioner Kyler saying that it needs to go away. I definitely believe it needs to be there. What
I
I'm
just don't want to be vague to anybody.
No, I got you. What I'm saying is, I want to make sure the 2035 master plan and us moving forward is meeting the vision of Carroll County. And, this ties in very well as we make those decisions. So that's why I think the next logical step would be go to the Planning and Zoning Commission. I mean, that's.
And I think,
where I'm at.
and you were one that mentioned it when I was Board of Ed, but what we were constantly hearing is we needed to redistrict so they could build houses. Well, that shouldn't matter. And
Yeah, that's the lousy argument. I mean, we have to
Yeah.
be better than that. So all these issues about redistricting things, I'm not going to argue that they're not the right place
Yes.
and forum to discuss what we're discussing. It's sort of tertiary, but
Yeah, yeah. And,
So, I
and
mean, that, again, I don't have any preconceived notion on what this is going to provide. I just think let's give it to the Planning and Zoning to then make sure we're adhering to what we want to adhere to as we walk into the 2035 master plan. And if it needs to be tweaked or
Yep.
changed or altered, then we make those changes. That's all.
yeah.
That's my convoluted motion.
So does somebody want to make a motion that
I did.
we asked staff to evaluate the concurrency management?
I
or-
did.
Oh,
And then to take it to the Planning and Zoning
Okay.
Commission. Yes, that's my motion.
is there a second?
Second.
We have a motion and a second. Any further discussion?
I'll just, I'll throw in here, like I said, I'd open to a discussion with the hope that, there might be some more information. So I will vote no against this today just because I don't feel like I'm informed enough to say, yes, send it to planning and zoning or not. I mean, for example, there's
How
a
would
well,
you get informed?
well, for example,
From them? Right.
Well, in part, but, having conversations with maybe some members of the Board of Education, having a nice conversation with you because you have experience on there. So it's not that I necessarily disagree or agree, it's just I'm not prepared to go.
Understand.
Yeah, okay.
Any more discussion? All those in favor?
Aye.
Opposed?
No.
No.
So 3-2, passed?
Man, I can't win.
Thank you.
So, Commissioners, if,
I'll
Oh,
tell you, that just sucked because I agreed with Commissioner Garrett.
yes,
I don't know. Yeah, I'm not sure. I mean, I appreciate that, but I'm not sure we did. As much as I'd like to say we did.
I think we did.
I think
do.
if we both agree that the situation in the Freedom area is acute and it also spreads to a couple other areas that are unincorporated, that's definitely something that we would
Okay,
agree
so
on.
I agree, and I
Yeah.
figure.
But that's
in order-
different.
No, I appreciate it because I just want to finish that because I agree with you. In order for us to get in front of this, we got to look at this APFO process, and in order for us to make a appropriate decision, I want to give it to the Planning and Zoning Commission to dive into this, and Commissioner Gordon's on that. So, that's, why? Because, I think we're agreeing at least on the end state.
The basis of it. And I just,
Okay.
my experience being up here for 2 years is that once that train leaves the station for planning and zoning, something's going to happen and things are going to in motion, and that's what we're doing. I think that's just my personal.
We still have to vote on it.
I know.
And if I may, if I could make a recommendation, so this is a lot to digest, and we're talking about eating an elephant here. And what I'd like to recommend is that at a staff level, we'll digest this and the direction from the commissioners and put together a work plan on how we want to eat this elephant. And we'll bring that back to you before we fully engage the Planning and Zoning Commission. And then if we get nods from all of you that that's a good way to proceed, then
We're not saying it's the next emergency, but.
Right.
Yeah, but.
Okay, in that case, we got to move back. If we're not going to accept the motion I said, and I understand where you're going, that's fine as long as, but I made a motion to go to planning and zoning if we're just telling
you're
the
gonna
staff
tell
to
us
do it.
how.
Yeah, and we're
He's
just going to
gonna
lay
tell
out the
us how.
process of how we're going to do that. So we're going to move down that road.
Okay.
But before we jump off the bridge, we'll back before you and make sure that we're
all jumping together?
We're all jumping together, yes.
As long as you don't have us in another work group.
Fair enough.
Yeah, I might be partially responsible for your workload. It seems like I'm sending you something every single day
Not
from
a
my
problem.
district, so appreciate
But
it.
understand the sentiment, and that is, the bookends here are very concerned about the Freedom District, the growth areas, and making sure it stays with the vision that we
Yes.
have in place.
You just called it a
Especially as we're
bookend.
going 2035.
I'll take that. No, that's a
Understood.
military term. Bookend, yeah.
Can a developer ask for a waiver of this?
For the APFOs? So yes.
That whole process.
Yeah, so the APFO really is a series of warning lights, dashboard warning lights, that it warns you all, it warns the Planning Commission that there may be an issue. You can choose to ignore the warning lights, and there are processes in place where you all, and we had this with Mineral Hill, where you can then move past and keep driving with that flat tire indicator, right?
Yeah.
So it's not an absolute stop. It's here's a warning and proceed with caution.
Yes.
Yes, we'll come back before you with a work plan on how we may move forward with this and make sure that we're all jumping off the bridge together. So,
Did I mess up your item 9, or
I don't believe so.
we're good?
Do you need to hear item 9? No, I'm just kidding.
You want to drive or shall I drive?
You can be the clicker.
Okay.
We're good. We're a good team. Good afternoon. So we're here, our annual appearance before you with the concurrency manager report. So per chapter 156, we do compile all of our data for development over the past fiscal year and then translate that for you into a full summary in the report and recommendations. This is completely, if you could go to the next one, thanks. So concurrency began back in 1998, and this report has been coming to you every year, and it's strictly for your informational purposes. So you can take a look at what's going on in terms of development, and you can understand that chapter of the code and all of those thresholds that are put in place. So informational only. Advises, first we went to the Planning Commission and advises them as they are approving those development plans, and also for your use as you're reviewing the CIP. So the timing of this is intended to then help inform your CIP decision-making process. And in the end, we provide recommendations that are centric to residential growth in the county. So you can read the chapter of the code is up on the screen before you, but the basic overall, the purpose of this chapter is to ensure that residential growth in the county will not unduly strain our public facilities, right? So public facilities, in this case, in this chapter right now, does include schools, roads, water and sewer, police, fire, and EMS. Again, not jurisdictional to the municipalities. They independently define their adequacies, and they do have their own adequacy measures in place. In terms of the type of plans that we're processing that are then subject to this chapter, it does include major subdivisions, so that's anything beyond the first 3 lots you take from a particular parcel, and site plans for residential. So we just talked about like age restricted, for example. So you're not dividing that property into a series of lots, but you are developing it for residential purposes.
Laura, each county is different. You know, our neighboring counties, we're different, and I like it that way. So there are some things that we want to maintain as Carroll County and Carroll County communities. There's other that are national standards like fire, EMS, you know, there's
Response times. and
response times. Those are national standards that we work hard to adhere to. Have you done comparative analysis to other counties, you know, possibly like counties in Maryland on APFO, on housing? I mean, you know, I'm not going to, throughout Washington County or Hartford County or some of the others that are more conservative, more culturally like us, even though Washington really isn't, but you know what I mean? You know, I'm not looking for, and I'm not dissing them at all, but I'm not looking for a Howard County or Baltimore County or Anne Arundel County or maybe the southern part of Anne Arundel County, you know, but I don't know. I mean, has that been done, or is there something out there?
We've done some informal
Yeah.
comparisons,
Yeah.
and we've also looked at, so each of our municipalities also have APFO ordinances and different things that they test for. So we have those informal numbers or concepts.
Yeah.
And as I'm processing what we would come back to you as far as a work plan,
Yeah.
certainly that would be part of the discussion that we would want to have with you all, because there may be a public facility that we don't currently test for, that another jurisdiction does.
Right.
That we would want to throw out to you all and say, do you want us to consider testing for ABC? Because others do. I would like to have those kinds of conversations with you to narrow the scope of what we would take to Planning Commission to make sure that we're in line with what the direction that you want to take us with the APFO. So that's what I'm envisioning, doing some of that research, compiling that information.
Okay,
So we
good.
can have that, all have that informed discussion.
Great answer.
So the next couple of slides are data charts, tables directly from the report. that you have, and you have it digitally or paper, whatever was requested.
yeah, thank you very much.
Oh,
Thank
the
you very much
Post-it
for
is
this.
still on there. Okay. So these are just glimpses into the numbers where we've been in fiscal year 24 and then back the previous 6 years. So we look all the way back for comparison purposes. So you'll see that we start with lots approved by the Planning Commission. So this mimics the process that Chris was just talking about, how we move through that engineering phase and the I don't know what you recordation and the construction end of it, right? So we see that the Planning Commission in fiscal year 24, we had a preliminary plans and then final plans, right? So what gets approved, and we did have 107 lots that had been approved in the preliminary phase. They are still moving to final. So final, those numbers, we were at 14 for this last fiscal year. And you can see how that looks over the past 6 years. There's not a lot of differentiation there, except for that most recent. We have had some larger projects that are coming through that you're all aware of in the county. So, and then we move to lots recorded, which those numbers are not going to directly come like the year after, right? We don't know when that they will move to that recordation, but you'll see there's 3 columns here because we do look at and include all the numbers within municipalities as well, and then the total. So that's kind of interesting, that column for the municipalities, and that we've seen a little bit slow down in terms of that. In the next couple of years, you're going to see those numbers go up. We do have some very large plans that we're processing in municipalities that will reflect in the lots recorded. And then if we move to the next slide, right now, building permits. So you record the lot, but when are you pulling the permits for those? Again, there could be a delay, but Chris already touched on that 6-year total of 2,310 is generally, that's where we're at right now. So we put in the numbers so you could see what we look like today and have for the past 6 years. Okay. Thanks. So I will say, for those of you who read the concurrency report front to back, you're aware that the current data, when we get into those different specific areas of facilities, it does reflect some adequacy challenges. And we know that. That is not a surprise to you. And those, however, we do expect that that data is going to look different in the next coming years. Okay, so next year should start to look different, and after that. And this is in regards to fire and EMS in particular. We do have a couple of inadequacies currently, but we have been in conversation with DFEMS and informed that their new system called the National Emergency Response Information System, it's supposed to go live in January of 26. So when that goes live, this is a national data collection system, and it's going to more accurately reflect those numbers that we're looking for. So we do expect that to look different in terms of fire and EMS after this system is instated. Additionally, schools, you've already discussed schools, and you're aware that school additions are coming. They are in the pipeline. Amy is lucky enough to be processing all of those plans, and I think we're at 12 right now that we have building additions for different schools within the county that we are processing. So the school adequacies that we are challenged with right now are anticipated to be improved through that existing adopted funding already in place for these additions that are going through a plan process with us. So with both of those things in mind, the recommendations that came out of the department this year, as well as the Planning and Zoning Commission, were that no building caps are needed at this point in time and no specific capital improvements beyond what's already in the CIP are recommended. So it's a little less eventful than last year's annual report, but I'm okay with that. So hopefully as well.
So this is a point in time you're not going to come back to us and say, yes, we need this capital project.
Not right now.
Commissioners, any questions, comments?
No, just thank you again for printing this up for me. I did not get to the end of it yet, but I'm working on it, but thank you.
Thank you.
And this is no decision by us. This is just a presentation and your recommendations.
Yep. That's correct.
Thank you very much.
All right, thank you.
Do we still have a patient public commenter?
Yes, we have someone on the line here, sir. Let's give me a few minutes. Public caller, could you please use *6 to unmute? You'll have 3 minutes. Please identify yourself. Thank you.
Yes, I believe, greetings, commissioners. Speaking of elephants, Catherine Adelaide, a member of the Carroll County Republican Central Committee. It's a great time to be a Republican. So thank you for the opportunity to speak and for all of your efforts. Thank you, Commissioner Kyler, for inquiring about what to do first in terms of presentations. I do think I appreciate doing the presentations first and then hearing your comments and then giving my public comment, because sometimes it changes my position and it's just great to have more information before I make, so that's just me for your information. So thank you for that. Carroll County Republican Central Committee immediate news. Our legislative breakfast is coming up a week from this Saturday, well, this March 1st from 8 to 11. And again, if you haven't gotten your tickets, go to ccgop.net. I really hope to see all of you there. Commissioner Rothstein, I appreciate your opposition, speaking of legislation, opposition to the gambling legislation. I am getting reports of this really affecting our young people and addictions. If they get kids addicted at about 13, they've got them for life, whether it's cigarettes, pot, or gambling. So I appreciate that, your comments about that. Our next meeting will be Thursday, February 27th at the Westminster Senior Center at 6:30 p.m. We'll be electing officers and focusing on the upcoming municipal elections. My pro-life report includes, we have a Carroll County Right to Life meeting, monthly meeting tonight at 7 p.m. at St. John's Catholic Church in Westminster. And the big pro-life news in Maryland recently was the state v. Patrick Rice, who's age 28, was found guilty of second-degree assault, 2 counts, and reckless endangerment against 2 elderly gentlemen. One I think was 80, and the 73-year-old ended up in shock trauma. This was all captured on video. This was at the Planned Parenthood. They did a peaceful prayer protest at Planned Parenthood in Baltimore, and it took them about a year to investigate and find the culprit. So at least there has been some justice. I did one protest down there several years ago, and I did lose a hubcap, but I didn't endure this kind of violence. So it was very shocking, and I'm glad to see there was some justice. And then finally, I guess in conclusion, I did want to commend the Board of Commissioners on your decision this morning to nix the Carroll Access Homeless Project in Westminster because of its inclusion of non-residents. Trump's rally is Make America First, and I'm really proud to see that you made Carroll Countyans first and picked people over profits. Great job, and I look forward to more of those kinds of decisions. Thank you very much.
Thank you. Is there any, commissioners, any admin session open items?
No, sir.
I have something.
Uh-oh.
Soon after Pam finished her presentation, she sent an email. She had received notice from MACO that there is a move afoot to shift all of the teacher pension costs to the local jurisdictions, to the counties, rather than just the unfunded liability portion to the counties rather than just a portion of it. And she would like to know if she would like, would the board like to draft a letter opposing this shift? I'm just looking for your Walker. I'm assuming that's
Yes, please.
Do we know what the number is? I think it's what, 2.5 or 3 million on that?
I'm not positive, but I think so. What the governor included in his budget was 2.6. That was mostly about school system teacher pensions, but also included community college now for the first time. And then what Roberta's looking at has a number of 2.5, which seems like the right sort of number to go with that.
Okay, thank you.
And Delegate
That's
Stonko
correct.
said they miscalculated it, that it's probably higher.
Oh, boy.
So I will,
They didn't use blueprint new salaries in their calculation.
oops, that's a big oops.
Basic math.
So, the board would like
Yes.
to do that. Okay, so I am telling her now. Thank you very much.
Thank you.
That's it. Thanks, Ted.
Um,
And you have,
We need a motion to approve the closed minutes from February 13th.
So moved.
Second.
Have a motion, a second. Any discussion? All those in favor?
Aye.
Opposed? Approved. Agenda.
Hello,
Good
Wanda.
afternoon.
How are you?
Okay, Monday, March 3rd shows no activities. Tuesday, March 4th at 10 a.m. Commissioners' open session, budget overview presentation.
It's just the wrong order, that's all.
On Wednesday,
You got them in backwards.
week one is in week two, and week two is in week
oh,
one.
they're backwards.
Yep.
Okay, sorry.
Wow, time zone.
Yeah, Kenny's
travel.
throwing us into March already.
Yeah, I was going by week one. Monday, February 24th, public hearing for Spring Valley Solar at Pleasant Valley Fire Hall, Commissioner Kyler. Union Bridge Town Council meeting, Commissioner Vigliotti. Tuesday shows nothing. Wednesday, and
That's canceled.
all that's canceled. There's no Mako
Correct,
meetings on Wednesday.
correct.
Carroll County Public Library at Exploration Commons, Commissioner Gordon. 8 a.m. closed admin, 9 a.m. open session, an annual proclamation for FFA week, legislative update, approved grant submission, accept award for Office of Overdose Response, annual transportation plan, upfitting of 3 sheriff's vehicles, option to purchase on the Wayne K. Thomas property, option to purpose on Dwayne and Janice Arbuthnot property, option to purchase on Donald Lensner property, public comment, agenda review, master plan, open house at North Carroll Library, Commissioner Kyler, and on Saturday, celebrating American history, Commissioners Gordon, Rothstein, and Vigliotti.
And on Friday, I'll go down to Annapolis, testifying with Pam.
On Friday, the
28th.
28th.
Yeah.
Okay, now, the week of March 3rd. On Tuesday, Board of Commissioners open session, budget overview. On Wednesday, those are all canceled also. All Mako activities, overdose prevention policy group is Commissioner Guerin. Blueprint Town Hall with Superintendent McCabe and Century, Commissioner Rothstein. Planning and Zoning Commissioner, Commissioner Gordon. Public hearing for Cape Horn Solar Project. And that's at Manchester Auxiliary Building at the Carnival Grounds, not at the Fire Hall itself. And they did say it was at the Fire Hall itself. They were incorrect and got corrected. On Thursday, closed admin, open session, priority Carroll, adult drug court submission of application acceptance of award, grant submission and application and acceptance of award for circuit court, Jurisdictional services grant submission for circuit court, legislative update, blueprint fiscal compliance and state changes, Superintendent McCabe, public comment, agenda review, 1 p.m. Commerce, virtual, Commissioner Rothstein. Master Plan Open House in Eldersburg, Commissioner Rothstein. Friday and Saturday, show no items, and Commissioner Gordon does the podcast. Any further comments or on agenda review? Would somebody like to make a motion that we go into closed and then adjourn at the end of closed?
So moved.
Closed for public safety.
For public safety.
So moved.
Second.
All those in favor?
Aye.
Opposed? Thank you.
Thank you.